Good
Do
afternoon.
so
Yes,
by
Chair,
just
we
calling
do.
the member.
Thank you.
We do form a quorum. Okay. Thanks. There might be some members who will still be traveling. I think by virtue that we do form a quorum, we can proceed. Because this meeting was supposed to have started at 16:30, and we want to apologize to all of you who logged in particular at 16:30. Majority of members at the time was in the chat. That's the proposal that we start the meeting now at 5:20. Having said that, can I ask the secretary to flag the agenda for today? Yes, this is how our agenda looks like. We were supposed to finish by 20:05. Then with the extension of time, then we'll see how do we progress. Maybe until 9 should be there a need for us to proceed until 9 o'clock. Then, having said that, can I the agenda is as stated. Can I get a mover and the seconder for the adoption of the agenda? I'm watching for hands. Yeah, Honorable Mutobate.
Thanks, Chair. I would want to move for the adoption of the agenda.
Honorable Shabangu.
Thank you, Chair. I second the adoption of the agenda. Thank you.
Thank you so much, members, for the adoption of the agenda. Let me take this opportunity to welcome you, Minister, and the team. As you are aware, today we are dealing with your responses with regard to the issues that were raised by stakeholders during the public hearings. And then I want to say it up front that this processing of the bill is a top priority in our agenda. Later on, we will be adopting the program of the committee, and for those that feel the committee is not prioritizing the bill, I don't think they are fair, because I've been inundated with a lot of correspondences wherein we're being pushed that we must prioritize the bill, we must, as if we're not doing that. But what I want to say up front, there is a legislative process that as members of parliament we need to follow, and then we cannot deviate from that. There are several experiences where certain bills are taken to court. So I want to emphasize that this bill process is in our program, and we're going to go with that. There's no one who's going to pressurize us to deviate from the process that is laid out in terms of the protocols of and the rules of parliament. So that's the matter that I felt I need to raise quickly, because the secretariat, myself, we are of late receiving a lot of correspondences to that effect. But we'll still respond to those correspondences and then I must assure everyone not to worry. This is our priority for the term, that we need to get this bill processed and finalized. Having said that, I want to also welcome you, all of you, Minister, and hand over to you. As you are aware, there were public participations, visit to the province, and there are all those stakeholders that came and present to the committee. now it's your turn to then respond to all those issues, so that will assist us to go to the next step of processing this bill. Over to you, Minister. Minister, are you there? The team, Department of Health, DG.
Hi, good evening, Chair. Yes, I thought the minister was here and the deputy minister also is here. Let me call him on the side.
I can see they are all logged in here. Maybe because of those issues of members having requested that we start later, they might have been held up on something. Is Jeanette in the meeting?
I am in the meeting, Chair, but Minister was going to open. I think let's hear what DG says
because
about...
we cannot continue to waste more time. He can come in as you are presenting so that we don't keep... Deputy Minister Patla, you are in the meeting.
Afternoon, Chair.
Yes.
I'm not sure what is the hold up on Minister Mtsoleji, because we're both here. But in the meantime, as you said, he could come in. Let me just, on behalf of the team, thank yourself and the members of the committee for having provided this opportunity for the department to come back. As you have indicated, Chair, just to add that this bill has been around for quite some time. As members would know that it was initially tabled in the 6th Parliament, and then it ran out of time in terms of the process, and we're indeed very grateful that we have gone this far, including also dealing with issues relating to the NETLEC process, thanks to also your predecessor, Dr. Lomo, who was the chair, who also worked with us to make sure that that matter was addressed. So today we're here. The team is ready to present in response to various matters from the public hearings and various submissions. I think they've tried to consolidate those issues so that they don't have to say the stakeholder said this and so on, but just group the issues and then address them in as far as our response is concerned. So with your permission, we could get Ms. Jeanette Hunter, the DDG, to come in to present. Thank you, Chair.
Thank you, DM. And then as and when the minister joins in, then you will be able to talk to the issues. Jeanette, you can proceed.
Thank you, Chair. Let me greet the meeting with my photograph, and then I'll switch off and go on with the presentation. As you have noted, Chair, Minister is here. We don't know what's wrong with his sound. Deputy Minister DG. I'm also here with the team from Health Promotion, who work with all of us in the department on this bill, Chair. Chairperson, yeah, This presentation is dated November 2025. It's the same presentation we wanted to do in November 2025. The PowerPoint presentation has not changed at all since then. You will remember, Chair, that through this presentation, we also wanted to share with the Portfolio Committee on Health some changes that we made, that we are proposing to the bill as a matter of compromising to get the bill to move forward. And I will, with the Chair's and the meeting's permission, after the presentation is done, just briefly go through that. So next slide. The purpose of this presentation, Chair and members, is to present, let me just, I've just lost my, okay, I've got it back.
Jeanette, Jeanette,
Chair, just a sec.
as you do that, also raise your voice, ne? You seem to be too soft. Okay.
I will, Chair. I just lost the presentation when I was closing a window that was in my way, but I've got it back, Chair. I'll raise my voice. Okay, so the purpose, have I moved the slides, Chair? Has it gone to purpose?
Yes, Jeanette.
Yeah,
Yes.
there seems to be somebody writing with a red
The
pen on it.
purpose, yes, it's usually someone else who's watching, making these lines. It's definitely not me. We sometimes have this issue. I think if the person can just recognize it's them and stop, because it can also get worse. The purpose of this presentation is to provide the National Department of Health's position on matters raised during the legislative process to date of the Tobacco Products and Electronic Delivery Systems Control Bill, which we call in short the bill. Chair, has the slides moved to content?
Not yet. You can move it, try to move it.
I think. I'm having.
Jeanette, can we ask someone else to flight for you, please? If you are
Can Ms.
struggling.
Majalamba flight? Or I can unshare and share again.
Huh?
Let me stop sharing
What?
and try again.
I thought you were going to set up in there. Oh. Are you putting it here or putting it there?
No, whoever is our meeting.
No, this side.
DG, is the presentation back?
I should think, can we ask the Secretariat to check out whoever is speaking while the meeting is on? Such cannot be tolerated, please.
DG, is the presentation back? Sorry, Chair.
Yes, yes,
Okay.
it is.
It's now on content.
Yes.
Yeah, I'll just have to bear with
I'll let
this
you not
corner
moving if you're
thing that's in my way. Yeah. So the content of the presentation, we highlight the aim of the bill. We highlight policy changes introduced by this bill because we do have an Act, Tobacco Control Act, currently, and so we want to highlight the differences that this new Act is going to bring. We highlight the policies guiding the implementation of the tobacco control measures proposed by the bill. Then we go into the department's response to issues raised during the public hearings and oral representations by those opposed to the bill. We go into the department's response to issues raised during public hearings and oral representations by those in favor of the bill. And then we just also communicate where we are with the smoking cessation program in the public health sector, and then we go to the proposed changes we want to make as a compromise as the department, and we have concluding remarks. Chair, I'm now on the aim of the bill, and we are saying that health promotion is a key priority for keeping people well globally, especially to protect them from the effects of tobacco and nicotine products, in view of how these products add to South Africa's burden of disease, the global burden, but here we are talking about South Africa. And this is clearly expressed by the World Health Organization's Framework Convention on Tobacco Control, the FCTC, passed by the World Health Assembly and which became legally binding on 27 February 2025. And just for those who don't know, the World Health Assembly is a gathering of all ministers of health and health experts under the auspices of the World Health Organization. The FCTC is the most supported convention in the United Nations, and it's supported by many countries around the world. This bill is the domestication in our country of the convention, and we are signatories to that convention. And through that, we form part of 183 other countries. Chairperson, the next bullet, we as the Department of Health seem not to say loud enough, or we are not heard. Because often in the press, this bill is referred to as a draconian bill. And the message that is being sent to South Africans is that as if we are banning smoking, and as if we are banning the sale of cigarettes. And that is not what we are trying to do. And as this bullet says, the bill is not purporting to ban tobacco and related products. But what we want to stop is indiscriminate marketing and supply of tobacco, nicotine, and non-nicotine products to protect the health of South Africans, especially the youth. The bill's objective is therefore to decrease easy access and initiation to prevent conditions caused by tobacco, nicotine, and non-nicotine use, to keep South Africans safe and to reduce the strain on the health system. So the policy changes introduced by this bill, we want through the bill to regulate the electronic nicotine and electronic non-nicotine delivery systems, because the current bill is already regulating standard cigarettes. We want to introduce plain packaging with graphic health warnings and pictorials. We want to disallow display at the point of sale, because the display at the point of sale is triggering to people who are trying to quit. Display at the point of sale is another marketing device. And we want to disallow it because not only can it interfere with persons' plans to quit, but it's also inviting those who don't smoke to try it. Because as we know currently, these products are very attractively packaged. And as I say, display at the point of sale is another marketing tool. We want to introduce, Chair, 100% smoke-free areas in indoor public spaces and certain outdoor areas. We, as South Africans, we're already enjoying the benefits of clean air, breathing in clean air. And ever so now and again, by mistake, you walk into an area where people are still smoking, and it really just spoils the environment. And you can immediately, as a non-smoker and someone who's used to clean air, feel how the inhalation of that smoke is interfering with your respiratory tract. And we also want to disallow the use of vending machines, because through vending machines is providing access to underage children. Chair, we want to highlight to the committee the policies guiding the implementation of tobacco control measures. It starts with our Constitution, Chair, specifically Section 27, where it talks about a number of rights, of which health is one of those rights. And it is particularly saying that we must provide access progressively development goals. The Sustainable Development Goals are, among many other targets within health, that we reduce mortality due to non-communicable diseases. And we know smoking is a risk factor. A beautiful picture of our National Development Plan, which is a government-wide policy instrument. And the National Development Plan, again, amongst others, I'm highlighting the issues that are caused by smoking, again, amongst others. The NDP asks us to prevent TB and manage people better who already have TB. And it also asks us to decrease the incidence of non-communicable diseases. Then there's the global strategy to accelerate tobacco control as a 2019 to 2025 strategy. And this is the strategy for delivering on the World Health Organization and the Framework Convention on Tobacco Control Principles. And then, of course, to the right, we have the Framework Convention on Tobacco Control. Chair, staying with policies guiding, but wanting to be more expressive on the FCTC, we are saying that the World Health Organization's Framework Convention on Tobacco Control is the first treaty negotiated under the auspices of the World Health Organization. It is an evidence-based treaty that reaffirms the right of all people to the highest standard of health, and it introduced a regulatory strategy to address addictive substances. There are currently 183 parties to the convention, covering more than 90% of the world population. It was adopted by the World Health Organization on 21 May. So seriously do we take this as a government chairperson that South Africa became a signatory on 16 June 2003 and ratified this international treaty on 19 April 2005. Hence, we have an obligation to align the bill with this treaty. Chair, I move to the department's response to issues that were raised during the legislative process by those opposed to the bill. This slide, Chairperson, provides a summary of those issues, and they are, number one, that the bill is silent on illicit trade, and we need to address illicit trade because the new laws, plain packaging, will cause illicit trade, and the protocol on illicit trade and tobacco products needs to be ratified. Secondly, that there is enforcement of the current laws. Third, loss of jobs and revenue for the country. Then, vaping, nicotine and nicotine-containing products should be recognized as harm reduction products, since non-combustion is not harmful. New generation products should be legislated separately. The industry wants to continue to use flavors. Exemptions on communication and marketing required. The industry purports that it has the right to communicate with its customers, and the industry wants to continue to do online marketing and sales. And then the industry wants exemptions on display at point of sale limitations for street vendors. The following slides will deal with the National Department of Health's response to all these issues. On the first one, about our silence on the illicit trade, we are saying it is not true that we are introducing a new law before we are addressing how to deal with current laws. The current non-smoking laws, chairperson and committee members, are very well adhered to by South Africans. We do not see people smoking on aeroplanes. We do not see people smoking in restaurant areas where smoking is not allowed. This is not even in law yet, but when you go to an outdoor concert at Kirstenbosch Gardens or at other concert indoor venues like the one at Menlyn Main in Pretoria, everybody is asked not to vape. We don't even talk about cigarette smoking anymore because South Africans know it's not allowed. But people are asked not to vape, and there are securities moving around. When people vape, they are nicely asked to stop or they are escorted out of the venue. Many restaurants have already closed their smoking sections because they've realized that the people who smoke and patronize their establishment are fewer. And if they open up the whole restaurant to people who do not smoke, their revenue generation actually becomes better. Second bullet, so you don't always need visible policing, especially in developed countries. Citizens adhere to laws and they impose laws on themselves and others. Second bullet, the WHO and the World Health Assembly were acutely aware when they passed the FCTC that there would be a proliferation of illicit trade in the world. They immediately started a process to deal with illicit trade. And this led to the passing of the protocol to eliminate illicit trade in tobacco products. We continue with this response, Chair, still on illicit trade, where we are saying the protocol is a legally binding international treaty aimed at eliminating all forms of illicit trade in tobacco products. This is the first protocol developed under the WHO FCTC. It was adopted by consensus on 12 November 2012 at the 5th session of the Conference of the Parties of the WHO FCTC. South Africa, again, because we take this area seriously, because we take the health of the citizens seriously, we became the first country to sign this treaty on 10 January 2013 in Geneva. The protocol supports the implementation of track and trace systems with no interference by tobacco industry and its associates. Chairperson, wherever you see these blue writings with the lines under, those are links to papers which members could follow to check up on and to look at expansions of what we state on the slides. We continue with the illicit trade issue. So what remains for us is that the South African Parliament must ratify the protocol, which is already binding globally because it has been ratified by the required 40 countries to make the protocol binding. And thereafter, the protocol will be implemented jointly by the South African Revenue Services, Treasury, the National Department of Health, the Border Management Authority, and the South African Police Services. Chair, we move on to the issue of plain packaging. As the industry says that plain packaging will cause illicit trade, and we are saying it's absolutely not true. And I share with the meeting the reasons why we say it is not true. In 2012, Australia became the first country to introduce plain packaging. The tobacco industry argued that this will increase illicit tobacco trade and took the Minister of Health in Australia to court. At that time, the Minister of Health in Australia was a woman, and therefore we say she won the case. It was appealed, and she again won the appeal. The case was then taken to the World Trade Organization, and it was decided that the World Health Organization and the World Trade Organization, both being agencies of the United Nations, must resolve this issue. It took them 10 years, Chair, to resolve, but eventually it was resolved in favor of health, whereby plain packaging in Australia was upheld. The World Trade Organization's 2018 report contains rulings rejecting complaints against plain packaging laws. The World Trade Organization dispute panel stated that the evidence showed that plain packaging did not lead to an increase in illicit tobacco trade. And again, we put the link to that 2018 report on this page, Chair. Chair, we continue with the issue of plain packaging by saying that illicit trade has not increased in Australia since the implementation of plain packaging in 2012. Extensive national surveys have shown that the use of tobacco decreased following the implementation of plain packaging. Court rulings in Australia, France, the UK, Norway, and the EU have been upheld to the effect that plain packaging of tobacco products is lawful and does not breach constitutional rights, intellectual property rights, or protections under other relevant instruments. We continue with plain packaging, Chairperson, and we are saying, in addition, a study published in the British Medical Journal found that plain packaging does not lead to an increase in the smoking and exposure to illicit tobacco, and it urges governments not to be discouraged from implementing plain packaging. Studies have also shown that plain packs are no easier to counterfeit than branded packs. Chair, we move to the issue of non-enforcement of current laws, and I'll probably not spend a lot of time on this slide because on an earlier slide I already referred to some of the statements that we make on this page. But just to say that there is successful implementation of the current tobacco laws, as I've said earlier. I've spoken about the restaurants and other places, but I can add here, Chair, that at schools, children through suggestion boxes are requesting that teachers do not smoke or stop smoking around them on school premises. And I've spoken about the hospitality industry, how they increase their space for non-smokers. But this is not just anecdotal. There was actually a report released in 2018 that showed that 44% have voluntarily gone beyond the prescripts and they've made their restaurants 100% smoke-free. Taxi associations are deterring smoking in taxis, And I've also spoken about entertainment venues in South Africa that do not allow vaping. Chair, there was also a statement by those opposed to the bill that there will be a loss of jobs and revenue for the country. And our response is that the issue of job losses and revenue for the country were also raised when the legislation was passed for the first time. And these claims never came to be a reality. Research has proven that in many instances, tobacco smoking takes away more from the economy than what it gives to the economy. Chair, this meeting has had a presentation by UCT's research unit on the economics of excisable products. And they actually proved through research how much more we lose through smoking and how much an economy can gain when less of its citizens smoke. Whatever tobacco contributes in terms of jobs and revenue is far outweighed by the expenditure on diseases like cancer, high blood pressure, strokes, and absenteeism from the workplace leading to low productivity. At any rate, people need to live first and they need to be healthy first to be able to participate in the job market and bring in revenue. So the health of the people should be put first, Chair. In addition, COSATU participated at NEDLAC and made an oral submission, and they did not have an issue with loss of jobs, but they prioritized protecting the health of people. Chair, next issue was vaping, nicotine and nicotine-containing products should be recognized as harm reduction products, since non-combustion is less harmful. Chairperson, you will see that later when we introduce our proposed changes to the bill, it's actually in this area. But nevertheless, as the health sector, we still believe the following. The harm reduction theory pushed by the tobacco industry and its proponents argues that vaping and nicotine-containing products are less harmful and they should be viewed as harm reduction products. And further to the above, they have made a call that these products be legislated separately. The following two slides communicate the Department of Health's view in this regard. We are saying nicotine is not safe in utero, has significant cardiovascular effects like blood pressure, strokes, diabetes, peptic ulcers, and many others. Nicotine has also been found in South African studies to impair the response to TB treatment. In a country with high prevalence of HIV and TB, this impact is important to note. Now, there were also opponents of the bill who were saying that we've been using nicotine patches to wean people, so what is the difference? Why are we against nicotine delivery systems? Chair, it is well known that nicotine patches do have nicotine, but that they are designed to result in a slow release to wean people off the addiction to nicotine. And this is unlike a vape nicotine products that really flushes the body and the brain with nicotine to create and sustain addiction. Anyone listening to this presentation who know people who vape know that the majority of them vape so regularly because they're always in search of the next hit. Then there was also an issue that said the new generation products should be legislated separately, as I've indicated on an earlier slide, but here we give our response to this issue. We do not see any gain in coming up with many pieces of legislation, since this will require a separate legislative processes like public hearings, etc. we can put all tobacco and related products in one bill, and if we need to, we can differentiate between them. And we can do so in different sections of the same bill. Countries around the world are actually legislating tobacco and other products in the same act. And examples of such countries are Sweden, Canada, the UK, and New Zealand. Chair, this is a YouTube clip where the Prime Minister of Singapore announces the increased fines and repercussions for vaping and selling vapes in the country. I will not play it, but the members can play it for themselves. I'm sure many members have already watched the Prime Minister of Singapore talk about it, of the higher sanctions against vaping and selling vapes. But in essence, what he was saying, and for the sake of time, I will not play it now, but in essence, what he is saying is you do not know what's in the vapes, and that they have found that very dangerous substances have been put in nicotine delivery systems. And they recognize nicotine as highly addictive, and contrary to wanting to promote health, and therefore they are banning it, and they are imposing heavier sanctions on people who vape and who sell vapes. Chair, on the issue where the industry wants to continue to use flavors, our response is one of the most effective and dangerous tactics employed by the industry was to use flavors, because these flavors attract new users to nicotine, particularly adolescents and children. Flavors makes it easier to start because it makes the initial bad experience with nicotine and tobacco more palatable. And so it makes it easier for people to start and continue to use nicotine, and therefore contributes to both initiation and long-term use. Chair, then there was the issue where the industry is asking for exemptions on communication and marketing, because they want the right to communicate with their customers, to engage in marketing and sales. And the industry pushes for the bill to recognize that the new generation products are of low risk, arguing that there should be communication with consumers through all forms of media, including marketing, sales and advertising, especially online. And our response is that the industry does not have a monopoly to communicate with anybody, and the consumers are not necessarily theirs. In the National Department of Health, we have a mandate to protect all citizens from smoking and the diseases caused by smoking. The industry does not own any citizen in the country or elsewhere. And we don't want to give such an exemption, because the exemption will perpetuate indiscriminate marketing, including to young people and children. And the bill does not infringe on the right to communicate with other businesses. But we do not want indiscriminate communication to the population, because it will have a detrimental effect on young people and children. Next issue. Those opposed to the bill also want exemptions on display at point of sale, limitations required for vendors, street vendors. The industry argues that hiding of merchandise will be impractical, and that street vendors will have difficulties in selling their product if they are not displayed. We do not agree with this, Chair. Vendors are allowed to display a notice giving a list of what they sell. They will put their tobacco and nicotine products, in a box under their table. And as people come and ask for it, they will be able to sell it. And the reason, Chair, again, as said earlier, this is a point of sale. If cigarettes are allowed to be displayed on the vendor's table, someone who's trying to quit will pass it. And again, I'm saying it's triggering. Branding is very, very powerful. It's a powerful trigger. And it's not only about people who are trying to quit, but it can also attract people who have not yet started to smoke into smoking. So we're saying placing tobacco products and nicotine-containing products out of sight helps safeguard young people, and it justifies our approach. Chair, we move on from those comments by parties who were opposed to the bill to comment from parties who are in favor of the bill. And we are saying upfront that the issues raised by individuals and organizations who are in favor of the bill are very similar to the department's viewpoint. But we continue to describe it in the following 8 slides. The people who came to hearings and who came to do oral representations to the Portfolio Committee on Health were explaining why South Africa needs the bill, and they were saying that the bill seeks to improve the policy framework on tobacco control, repealing the Tobacco Products Control Act number 83 of 1993 with its amendments, and its aim is to promote public health as encouraged by the World Health Organization's Framework Convention on Tobacco Control. And our reasons for stating this is as follows. The current Tobacco Control Act is outdated and not in keeping with new product development. The provisions of the current Act has been overtaken by the introduction of new products, and we therefore cannot regulate these new products, these new nicotine delivery systems under the current Act. And we do want to regulate it, Chair. We do want to say it cannot be displayed at point of sale. We do want to say that the industry cannot communicate with people online, which will give young people access about these products. There is easy access to tobacco and new generation product exposure and initiation of children and youth in South Africa. There is aggressive marketing because we've got no tool to regulate this marketing, and therefore it's aggressive, especially in terms of new generation products. And it makes it difficult for people to then quit smoking, and it makes it easy for those who are not smoking to start smoking. And this makes addiction a huge concern in South Africa, Chair. We continue with the same point to say there's a huge economic cost of the use of tobacco. For every R1, and I'm quoting research here, and we've given the link to the research. For every R1 in cigarette sales, the economy lost R1.50. Smoking was responsible for over 14 billion in terms of health expenditure. The cost of productivity loss, 369 million, and the cost of premature death, 28.5 billion. The biggest costs were due to chronic obstructive pulmonary diseases, tuberculosis, cancers, and ischemic heart disease. According to the research unit, I've quoted them earlier, but I want to quote them again. According to the research unit of the economics of excisable products at the University of Cape Town, the department loses 14.8 billion in relation to healthcare costs and smoking-related healthcare costs. The economic cost of smoking is just astronomical in comparison to our GDP, and we are quoting 2016 data. In 2021, the social relief of distress grant was 350 Rand. And in the same year, South Africans spent 263 per month on cigarettes. And this just shows the power of addiction. And South Africa's government has got a duty to try and help South Africans to break free from this kind of addiction. Everything mentioned in the previous slides impacts South Africa's burden of disease negatively. And we just want to give a few examples, Chair, to illustrate this. Non-communicable diseases has become the leading cause of death and disability in South Africa and globally. And globally, it's responsible for over 43 million deaths annually. Chair, if we look at this graph, we will see that tuberculosis used to be our #1 killer. Sorry, I just want to get the graph in. I'll stop scrolling now. Thank you. If we just start the graph on the left and we look at 2018, that line, the red one with the red dots, is TB. It used to be our #1 killer, and because South Africa invested in TB, it is coming down. But there's other data that also shows how much more men are dying of TB, because there's much more men smoking in South Africa than females. And then, of course, if you look at 2020, there's just a dot without a line because it came from nowhere. COVID was then the top killer. Now, but if we go back to 2018 and just look at the blue line, which is diabetes, you see how diabetes has overtaken everything and become the #1 killer in the country. And then also cerebrovascular diseases, and the green line, and then followed by the hypertension, which is yellow, going up. And so I just want to show that the three top ones, that blue line, the green line, and the yellow line, are non-communicable diseases. And those are conditions that can be prevented. And smoking is a huge contributor. And Chairperson, if you look at TB, that's come down, but you look at that, it came down from 27,500 to just over 200,000. We are still losing too many people due to TB, Chair. And imagine if we could get less South Africans to start smoking and more South Africans to stop smoking. We can finally possibly kick TB out of the country, and it is as straightforward as that. Smoking is not a good choice for anyone to make, but once people unfortunately start, they become addicted, and it is government's responsibility to create the environment to enable people to make other choices, not to start smoking, and to enable people to stop smoking. And this is exactly what this bill wants to contribute to, Chair. I'm not going to spend time on this graph because it says the same thing, that non-communicable diseases are now leading in our country. And these are diseases of lifestyle, and it's avoidable. I spoke a lot on the first slide, so I'll pass this one, Chair. Chairperson, this slide also just shows that smoking negatively affects almost every part in the human body. And I'm also not going to spend time on it because I think I've highlighted these issues earlier, even when we spoke about the economy, the fact that it puts a high burden on the health system and that the health system has to spend money it could otherwise use differently. This one also, again, speaks to the negative effects of tobacco and nicotine-containing products on health. And it quotes deaths from smoking in South Africa, saying over 32,000 South Africans died from tobacco-related disease in that particular year, and that males were 22,800 and females were 9,600. It's very interesting when we look at South African smoking statistics that over 36% of males smoke and just around 9% of females smoke in South Africa, and you can see the difference in these figures in terms of the deaths. 5.8% of male deaths and 2.9% of female deaths were caused by smoking-related risks, and then over 13% of non-communicable disease-related deaths in South Africa are attributable to tobacco use. Research shows that among virally suppressed people with HIV, tobacco smoking decreases life expectancy by 3 to 5 life years, while when you quit, you could gain 2 to 3 years of life years. The next slide talks about the negative effects of tobacco and nicotine-containing products on health. And it says that nicotine negatively affects the development of the human brain, starting by saying that development of the human brain is determined by both genetic and environmental factors. The human brain develops right up to from the time of the fetus being in uterus to about 25 years of age and continues to grow afterwards, but at a slower rate. And that nicotine negatively affects brain development, especially in children and youth. Chair, I'm coming towards the end, where we just want to share with the committee what the status is of the first one, creation of awareness of the harm caused by tobacco and nicotine. We are saying we are performing well there through our own efforts as the department and through working with academic partners and NGO partners. We have escalated and we continue to escalate the awareness of harm caused by tobacco and nicotine. We provide counseling based on people's own decision to cease smoking due to the risk to health identified by a health worker. So when a diagnosis is made or when it is shared with an individual that you are at risk of developing a certain condition and that your smoking contributes to it, and they express a willingness to cease smoking, we commence counseling. And this is available from primary healthcare level because, as you know, through the mental health grant, we are appointing more psychologists and counselors to the primary healthcare facilities. And we are also helped by NGOs with counseling. You will see, Chair, by that cross over the yellow amber dot that we are not yet initiating people on nicotine replacement therapy in public sector. And this is a goal we aim to work towards, to start with that. But as far as ongoing counseling and support is concerned, we are doing that. And we also just want to share with the committee that the National Council Against Smoking's quit line is subsidized by the National Department of Health. Chair, I now move, I think this is the last two slides, last 2 or 3. So we've, when we responded, Chair, to comments made by those opposed, as well as comments made by those for the bill, we repeatedly express our viewpoint on the dangers of smoking and the use of tobacco and nicotine products. We want this bill to be passed, Chair, and therefore we are willing to make trade-offs to see it move. Of course, for us, the first prize will be if the Portfolio Committee on Health recommends that the bill goes through as is. But if that is not possible, we are willing to make concessions, Chairperson. So changes that the department proposes to make, after considering comments during the public hearings and oral representations, are in the areas of product differentiation, plain packaging, and illicit trade of tobacco and related products. So I will, with the Chair's permission, show the meeting what we are talking about, but we are saying we could make a differentiation in terms of non-combustibles when it comes to plain packaging and graphic health warnings, and that we also want to commit the department to work very hard with other bodies, relevant bodies, in combating illicit trade in the country. I think I have said this, and I will do concluding remarks, Chair, before I move to the actual changes in the bill. And the concluding remarks are that the Department of Health calls on the Portfolio Committee of Health to pass this bill into law. Passing the bill will, just want to make sure I have the whole slide in. Passing the bill will significantly reduce the burden on the health sector due to the incidence of illness due to smoking and nicotine use. Nicotine and other tobacco and nicotine delivery systems use. This will leave room in the health system to attend better to persons with unpreventable illness. Passing the bill will put the health of South Africans on a positive trajectory, especially the health of the youth. Passing the bill will, as we have indicated before, hugely benefit the country in terms of reduced levels of smoking and nicotine use. That is the end, Chairperson. Do I have permission to go to the changes we are proposing in the actual bill?
And we first, I see hands here. Honorable Van Staden.
Chairperson?
Can I continue, Chair?
Yes, yes.
Chairperson, no, my apologies for this, but we must remember now that the department can't come with new recommendations on the bill today. All we must do today is to respond to the public comments that we have done. So according to the legislative process, the department appears before us today to respond to all the issues that were raised by the stakeholders during the public hearings, and these responses will assist us as a committee during our clause-by-clause deliberations in making informed decisions. So for new recommendations or amendments, etc., can, in my view, only happen during the drafting of a list of a bill. Thereafter, a new amended version of is tabled called the B bill. I just want to bring this under your attention, Chairperson, that we do not deviate from the legislative process at this stage. Thank you.
Noted. Honorable Clark, followed by Honorable Shabangu.
Thank you, Chairperson. I'm covered by Member van Staden. Thank you.
Honorable Shabangu.
Chair, thank you. Mine is on the video that the presenter skipped because I'm not sure how long was it going to take. Understand what is in that video, if it contributes to this, what we are discussing here. Please, thank you.
Okay, noted. Honorable Mutubate.
No, thanks. I think I'm also covered by the previous two speakers. Enough, we can go ahead without going to the video. I think the link is there. We can go through into the video, because my worry at the end of the presentation was as if we are now going to be told or taught on the harm of cigarettes. We know that. I think we've passed that particular point. And I think people can go into the video and look into that. I think I propose that we move to the other areas. Thanks.
Okay, I don't necessarily have to divide the House on this matter. There's a proposal that Honorable Shabangu has raised, and then there's the counter proposal that Honorable Mutubate has raised. I need to be assessed. Is the new matter, Honorable van Staden?
No, it's just on the video, Chairperson. I agree with Member Mutsabatse. We can go and watch it on ourselves. I think we mustn't waste our time to watch a video now to get educated. We know the dangers around smoking and all that stuff. So I will support his suggestion. Thank you.
Okay. Yeah. This presentation, I should also think that it's now loaded in the PMG, Parliamentary Monitoring Group, wherein as it is, it has got all the links that then allows members of the public to also go through the video, and then including all these other related, because that's not only the video that I've seen. As and when one was reading the presentation, one would go to all the links that were also attached, so that one goes through to understand this referencing. I should think this was made for referencing, and under the circumstances, for the sake of time, because we still need to all comment on all these issues as raised. Maybe what I can do that if Honorable Shabangu strongly feels the video needs to play, when I allocate you the time, it can be played so that you make reference to it. Honorable Mutubate?
No, thanks. I was just raising my hand. I be noted.
You want to start to deliberate on the issues as presented now? I was going to, I think, Janet, for now, let's attend to all these responses and allow members to ask clarity-seeking questions and comments. And then with regard to what you propose to do, it can be done at a later stage, what you are proposing when we do deal with the other parts of the bill. Can I allow members to raise hands to interact with the presentation? Okay. The hand that I can see for now is to be Honorable Mutubate, Honorable Leroux, Honorable Clark, Honorable van Staden, Honorable Lekapes hand is up, Honorable Shira, Honorable Malo. Yes, in that order.
My hand is also up, Chair.
Can you
Yes.
note me also? It's Trego.
Okay, then it will be Shira, Kumalo, Shabangu, and Grego in that order. Honorable
Mine is also up, Chair. My
Oh.
hand is also up.
Where are you? Your hand is, you will come after Honorable Grego. I've noted you in that order. Sungula, what? Okay, it's, oh, you are raising your hand. I don't see you here on the system. It's fine. In that order. Can you start, Honorable Mutawatse?
No, thanks very much, Chair, for the opportunity, and greetings to all present and staff, support staff, colleagues, and all those who are in the platform. Can I request to switch off, Chair, because the light is not that good where I am.
You can proceed. It's fine.
No, thanks very much, Chair. Through you, Chair, I want to start with a concern that you raised earlier, being the pressure exerted on the portfolio committee. We are aware, Chair, of the pressure under which the department is under following the attendance of the recent COP meeting, where the South African delegation gave an impression that the bill would go through as is. And I think the presenter just confirmed the desire in the last minutes of the presentation. We want to say, Chair, I think these are sentiments that are of the new world order, because recently we have observed, and I think we'll come back to this particular issue as we move forward, that the department has in its view that whatever that has been agreed upon, and when we are signatories, they can do everything willingly without coming back either to the portfolio committee or to Parliament, so that those issues that have been agreed there can also be ratified by Parliament. And I think that is a debate that we must have, because I'm very much concerned about that attitude by the department. So we'll come back to that. We'll table it so that we can extrapolate this particular matter. But our view is that that is wrong, and we must be able to nip it in the bud moving forward. We are also aware, Chair, of NGOs that are heavily funded to push a particular narrative. Also, it was our view that the pressure that is being put, and we know, and without any, we know of individuals, we know of funding that has been pushed towards pushing this particular narrative. We request, and we want to be given space as South Africa to deal with our issues our way and the South African way. That's our request. Having said that, Chairperson, as the MK Party, we fully support the strong tobacco control and the constitutional obligation to protect public health. Our position is not anti-regulation. It is pro-effective regulation that works in South African real conditions. We believe that the bill can achieve its objectives without criminalizing poverty, culture, and informal livelihoods. Let's talk to the single bill and clear differentiation. We agree with the department that one comprehensive act is preferable to multiple laws. However, a single act does not mean identical treatment to all products. Different nicotine products carry different levels of harm, particularly between combusted and non-combusted products. Therefore, differentiation within the same act strengthens enforceability and avoids legal ambiguity. So, Chair, this approach is consistent with evolving international, and I think the presenter also makes that point, that it is consistent with international practice and does not violate few commitments. One act, different chapters, proportionate controls. That's our message as the MK Party. We also say in public health first, but smart public health. The goal is reducing diseases and death, not simply increasing prohibitions. Cigarettes remain the most dangerous form of nicotine consumption. Policy must actively reduce the appeal of combusted products, especially to youth. Regulation should drive behavior change, not push consumers into illicit market. And I think we want to emphasize on this point because, and I think we are comforted by the fact that now the department has ultimately moved from the harm approach and recognize and appreciate the reality, because our point was that if you come up with strong restrictions on cigarettes, you can have targeted controls elsewhere. So therefore, you're reducing illicit trade, which is a concern to all of us. On harm reduction, we recognizing the relative risks does not mean declaring products safe. The bill currently treats all products as equal in risk, which is scientifically and legally vulnerable. Therefore, differentiation allows government to keep youth protections strong, avoid misleading consumers, improve compliance. We are not asking Parliament to promote alternatives, only to regulate proportionately. Different risks, different rules, same health objective. And I think we agree that we on this particular point. Now, on standardized packaging, plain packaging must not unintentionally strengthen illicit trade. South Africa's illicit market is uniquely large and entrenched. Therefore, we want to propose, Chair, through you, Chair, that plain packaging on combusted tobacco first, phased implementation linked to enforcement readiness to avoid the repeat of the COVID era mistakes where enforcement lacked policy. Therefore, our message is that we must regulate hard, but regulate in the right order. The next point on point number 5, which is on illicit trade, which we spoke to earlier. Our point is that without explicit illicit trade provisions, every other control measure is weakened. The department itself acknowledges the crisis in this regard. Therefore, we want to propose that the bill must mandate interagency coordination, reference track and trace systems that require regular reporting to Parliament, and health outcomes cannot improve if illegal products dominate the market. Our central message is that you cannot regulate what you cannot control. And I think it's as simple as that: control so that you are able to regulate. On the informal traders, we making a point that we must not criminalize poverty, because the most people who will suffer is going to be our people, and it's going to be the vulnerable. You can see normally when people, the police, JMPD and all the rest, they don't go into these big malls to go and search and do all that. Our people are the people who are, and we are saying that we must not have a situation whereby these informal traders are going to be targeted and are going to be the ones who will be expected to pay what they don't have. Now, mainly they are Black, they are women, and they are youth. And we're saying that they do not create the tobacco epidemic. Blanket display bans and criminal penalties increase harassment, and that will also undermine compliance. Now, on the display at the point of sale, visibility of graphic warnings can be a deterrent, not advertising. So we must draw a line between the two. Now, products already have 65 graphic health warnings. Now, as the MK Party, we support increasing health warning size to 65% on combusted products and 30% for non-combusted products. So a complete display ban hides these warnings. You can't have something beautiful and you hide what is beautiful. You must display it. So the complete display ban hides. So it will be defeating the purpose if you hide, because this complete display hides these warnings from non-smokers, young people, communities, and it also limits promotional display with warnings visible. So we're saying warnings should be seen and should not be hidden. On cultural and traditional use.
Honorable Mutubadze, are you still there? We seem to have lost him. Can I allow the next speaker?
Thank you, Chair. Are you able to, I just wanted to show proof of life, and I will switch my video off.
We can see
for
it's you.
bandwidth reasons. Thank you very much.
Yeah.
Chair, thank you. Yeah, thank you to the Department of Health for the presentation. And well, yeah, it seems like.
Are you back? Sorry.
Yes, I'm back. I don't know what happened. Sorry, I sincerely apologize.
Okay.
Yeah, I sincerely apologize. Can I continue? Just
okay.
I'm just about to finish. I'm left with only one point.
Sure.
Yeah, I was dealing with the cultural and traditional use. We're saying that culture is not a loophole; it is a constitutional right. So tobacco use in traditional, spiritual, and cultural practice without exemptions is going to create problems. So we are saying that there must be clear exemptions around this particular cohort of people who are using snuff and all those for those purposes. There must be clear legislation that, but we'll talk to that when we deal with the close to close. On the monitoring committee, oversight must focus on implementation, not bureaucracy. Now, the committee should be intergovernmental, align with RG Framework Act, and avoid an unnecessary expenditure. Experts can advise without creating costly permanent structures. Our message is that it should be a lean oversight, but strong accountability. And lastly, Chairperson, that the MK Party believes that the bill can be stronger, fairer, and more enforceable. And we should do not weaken the tobacco control, do not undermine WHO obligations, do not protect the most, do protect the most vulnerable. A law that works on paper but fails on the ground will not help anyone. So, Chair, we thought that we must present this as MK Party just to give a clear picture of our approach and our attitude, so that there must not be any ambiguity around the position, our position, and our attitude towards the MK Party as an organization. Thanks, Chairperson.
Honorable Liro.
Thank you, Chair. This is me again. I'm going to switch off. Thank you very much for the presentation by the Department of Health and the responses to the many tobacco hearings that we were part of. I think that I mean, I would like to just make very clear that we agree with the Department of Health that smoking is a major health issue that needs to be regulated carefully. I think we do have fairly good tobacco legislation already that over time has decreased we've seen a decrease in smoking, although in the last few years we have seen, unfortunately, an increase in the smoking incidence in South Africa again. And I think we need to kind of interrogate very carefully why that is the case. And I didn't see that very clearly in the department's presentation as why they feel that, and why we see the trends changing in South Africa. And I think that it is, from my perspective, it's pretty clear that one of the main reasons why this is happening is because of the thriving and illegal tobacco market, where excise taxes, the so-called sin taxes, are avoided, and therefore cigarettes are very easily available and very cheaply available. And we know that all the tobacco control measures in countries where they've been successful have been dependent on good, on excise duties and good laws, like we have, but also on enforcement of these laws, which we have failed at significantly. And I think that I agree with Ms. Hunter that a lot of our laws are enforced, like in restaurants, etc. But the sale of tobacco products that don't have any excise duty on them and therefore are much cheaper is probably the main issue that is not being enforced in our country. And that means that it's very easy to get cigarettes, it's very easy to get cheap cigarettes, and the impact of the 24 rands excise taxes that should be on every packet of cigarettes, and therefore would limit young people trying cigarettes, adults smoking their cigarettes, is not being felt. And so my real concern is that we are bringing a whole lot of new legislation in, and we are bringing it in hoping that this is going to turn the tide, while actually the main issue is that we need to enforce we must ensure that illegal tobacco products are not being sold. And unless we do that, we are fighting a losing battle. I think it's very important that the Department of Health can clearly show us what they think the impact. Now the presentation it said we think that this is going to have a major impact, but is the point of sale ban or the point of display ban, is the plain packaging, what evidence do we have that is going to have the results that the Department of Health is asking for? And so I would also like to just bring up the point which was made by one of the Informal Vendors Association persons who owns he owns a tavern in I think it was Alexandra Township, and he basically said that since 2020 he no longer gets visited by the police to check if he sells illegal tobacco products or not. So for the last 5 or 6 years, he has not been visited. Before 2020, he was visited by the police, and so he was careful about selling them. But now, because it isn't being enforced, and because there is so much illegal tobacco products available, he will go out of business if he does not sell the illegal tobacco products. And I think that is the core of the issue that we have in the tobacco control aspect of South Africa. And I think we do welcome that this is more directly, and that the department is recognized that this must be more directly dealt with. But I think that's, for me, that's the first thing to say. The second thing to say is that we have some of the evidence that was shown was around Australia, and how, for example, the plain packaging did not push people into the legal tobacco would increase the legal part of the industry. But we know that Australia is a country with a much lower crime rate than we have. They have much better enforcement. And so I think that those examples that were used of countries in Europe and Australia do not reflect what will happen in South Africa. And I think we need to be very careful of the unintended consequences of this very strict legislation on a very small legal part of the economy, where the illegal and the illicit tobacco, where we essentially actually will penalize the legal tobacco industry, and we will push more people into the illegal tobacco industry, where there seems to be less and less control. So I think we do need to be very careful of those unintended consequences. I think that there are, on the tobacco front, I think that there are perhaps, from our perspective, are some things that we can improve from our tobacco legislation, particularly around smoking in nightclubs, in pubs, and in outdoor areas around restaurants. I think that is something that we need to think about and enforcing. But I think that I am not sure that unless we get on top of the illegal tobacco selling of illegal tobacco, which is now 70% of the market, that we will have any impact by bringing this legislation, and that we might actually make things worse for ourselves. So I think that's a very, very important thing that we need to consider, and those unintended consequences need to be considered very carefully. The second aspect, of course, of the legislation is a very important one, and that is the control of the non-combustible nicotine products. And I think that I think the very important thing that we need to get through here is that we need to make sure that by law it cannot be sold to children under the age of 18. And that is still, at the moment, by law, that is not the case, even though most vendors will not sell it to children. There is no law saying that, and I think that is extremely important. And I think in some ways it's a pity that we did not just, as a committee, change the current tobacco legislation to bring in a phrase or two, making sure that has happened, because it does feel like on the vaping side of things and on the non-combustible side of things, the horse is bolted, and we have a whole new generation of young people who are addicted to nicotine. We do welcome the differentiation between combustible and non-combustible tobacco products that the Department of Health is prepared to consider, and I think that that's a very important aspect that I know that there is concern that this is a line that has been pushed by the tobacco industry, but I think that sometimes we mustn't throw the baby out with the bathwater. And I think there is certainly some evidence in countries like Sweden that people moving from non-combustible to non-combustible products has been good for public health. So I think that has to be considered and recognized. I do want to just also talk about the informal tobacco vendors and the impact that display ban will have on them. And I think it is, I do want to echo what my colleague from the MK Party said about how this will impact small vendors who rely on this for income. And I think that although, again, as a medical doctor, I of course am concerned about the impact of any sale of smoking products to anyone. I think that it was important for us to recognize that there are people in townships who rely on selling these, and that their commentary was universally that this is going to make their lives extremely difficult. And I think we do need to recognize that. I think that I think that I will leave it there. I would like to have a response specifically on the topic of what the department understands the main reason for us going backwards in our tobacco goals are as a country, and how they think that these laws that they are bringing in will make an impact. If we could choose between very strong enforcement versus bringing these laws in, would it not be better just to have very strong enforcement? Not that the two are mutually exclusive. Thank you very much, Chair.
Thank you, Honorable Euro. Honorable Clerk, and order.
Thank you, Chairperson. Just to show you that I'm alive and a warm body, and we've had incredible problems here in the village this past week with connectivity. So I'm going to switch my video off now.
Okay. Proceed.
Okay, so a lot of the issues that Dr. Leroux raised were the issues that I feel very strongly about. I mean, in terms of the plain packaging, I mean, what evidence has been used that plain packaging would be far better to be sold within the market of tobacco, of combustible and non-combustible products? Because for me, I think it's far better that the risks that are within that product should be printed on the product, and I don't think that would make really any difference in terms of selling at point of sale. And then the department spoke about, and the media speaks about draconian, that the tobacco bill is draconian. Well, in some instances, I have to agree with what is being put in the public domain, because the issue here is the illicit trade and the draconian laws that are being put into the bill. You know, for instance, you know, you're going to get a 10-year jail sentence if you don't comply. I mean, who is going to enforce that? Our courts are so behind to start off with, and I mean, it's totally ridiculous that we have that kind of stipulation in terms of law enforcement within the bill. And when SARS and SAPS came to present to us, they clearly said to us that they really do not have the resources to police those draconian laws that are being put in terms of enforcement. I mean, they just can't, they just don't have the resources in order to do that. And then we speak about Australia and France and the UK and Norway and the EU. I want to know how that was benchmarked, because those countries' illicit trade is not sitting at 70% like ours are. So I think it's a very facetious way of presenting illicit trade to us in terms of European countries that have a far lower illicit trade than us. Then, you know, also in terms of Singapore, where the fines were introduced, I mean, Singapore hardly has any crime. So you actually can't compare Singapore to South Africa either. It's they're completely different when it comes to law enforcement. So those are the things that really worry me. And then, of course, you know, we 100% pro public health care and what it costs the health industry in terms of tobacco use, and 100% support that initiative in terms of what the bill is trying to achieve. But we also feel that non-combustible and combustible products should be split with their own regulations, because they are very different, the two products. And of course, you know, non-combustible products are not regulated at the moment, and that is of huge concern. And I think Dr. Leroux mentioned that in terms of the harm it has in terms of public use, and we do support that should be regulated, but it should be regulated on its own perimeter and not with tobacco use. So and also, you know, I'm really worried about people that are legally registered their businesses and paying their taxes, etc., and are going to be targeted, or are already targeted, should I say, in terms of illegal illicit trade within this country. And we all know COVID really exacerbated illicit trade in this country because of the regulations that were put in place. It just fueled that industry completely. And then, yes, I'm also concerned about the small vendors within townships that make their livelihood from selling single cigarettes, and, you know, the impact it's going to have on people. I mean, all of us in this meeting are not in the situation where you depend on that income to put food on the table for your family. And I think that is something that is of huge concern as well. And then the job losses within the industry is of huge concern. I mean, we've just seen that BAT closed their plant in, I think it's in Heidelberg. 650 people lost their jobs there. So, you know, what effect is that going to have on the tobacco farming industry, which contributes hugely in terms of jobs and in terms of, you know, in terms of taxes that are paid. So there is a fine line between what's happening here. I mean, obviously, we have to ensure that we deal with the health risk and what it costs this country, and that's a huge concern as well. And then we also have to look at the outcomes in terms of the legal trade, taxes, job employment, and of course the enforcement of illicit trade. And how are they going to do that? Also just want to mention that we sent a huge document through Chairperson to the Minister's office from our party in terms of suggestions of the bill. And obviously we will be debating that when we start working on the bill clause by clause. Thank you very much.
Thank you, Honorable Clerk. Honorable Chapter.
I think I'm next, Chairperson. Sorry.
Oh, my apologies. Don't know what happened.
No problem.
You
No
down.
problem.
Sorry, my apologies. And you are right in the list.
No
So I'm
problem.
following the hands that is on the screen now on my part. My apologies. Sorry.
No problem. No problem, Chairperson. I'm gonna shut down my video. My signal is also not very good here in the village, so just to show that I am here. Just a few points from my side. We heard today that the Minister of Finance announced that stricter measures in curbing the illicit trade on tobacco, together with SARS, the Border Management Authority, etc., is going to take effect. And he also mentioned the destructive effect of illicit trade on our economy. Now, I want to raise just 3 to 4 issues on this matter. During a meeting that this committee had with SARS and the SAPS on the 22nd of October last year, the Deputy Minister of Police stated in that meeting that the South African Police Service will not be able to deal with these challenges. And that was on my question regarding the offences and penalties in Section 16 of this bill. She also responded to say that this bill will cause us a serious problem. And I quote her now. I've made my notes while she was talking, and she answered to me. She also mentioned that the South African Police Service only have 1,164 police stations with budget cuts, problems with corruption within in the SAPS, and we see it now played out. They have trained 10,000 new officers per year, but 4,500 went on pension. They've got 180,000 officers currently in service. She said technology is not up to date and one detective deals with 300 dockets at a time. So there is not enough manpower with the SAPS or the Border Management Authority to enforce Section 16 of this bill. And SARS also said that law enforcement is a problem. So both SARS and the SAPS said that, and they actually warned that this bill will boost the illicit trade up from 75%. Now remember, there is currently a problem between the South African Police Service and the Border Management Authority regarding the BMA's budget, but is still within the South African Police Service. Now that problem also needs to be sorted out first. It is now 2 years and still not a solution to this problem. I've asked many times in Parliament since 2024 that this problem be resolved. So my question on to the department on this is, and I want to make a statement. You must remember, I just want to know, how do you plan to address these problems? If a current existing law and regulations cannot be policed, regulated and enforced, being done by the South African Police Services, Border Management Authority, etc., and you just said the current bill is very well adhered to by the public, but the policing of it is a huge problem regarding law enforcement that shoots up the illicit trade. So my question is, how will the department plan to address these problems? If I can touch on job losses and the socio-economic and employment impact assessment that, according to my view, was not done before this bill was tabled. I just want to bring under your attention a letter from the South African Federation of Trade Unions and the Food and Allied Workers Union that they issued on the 29th of January. And I just want to quote 2 paragraphs. They said that SAFTU, together with its affiliate FAWU, writes to request an urgent meeting and immediate government intervention regarding the accelerating crisis of factory closures, job losses, and the steady deindustrialization of our economy. They say our recent engagement with British American Tobacco over the proposed closure of its Heidelberg manufacturing facility, which threatens more than 200 direct jobs and thousands of dependents, is not an isolated case. It is part of a wider and deeply troubling structural pattern in which multinational corporations are closing local production facilities, relocating manufacturing outside South Africa, retaining owning distribution networks, and continuing to sell imported finished goods into the domestic market. And I want to bring to your attention, remember, COSATU are not the only union who can have a take on this issue. The other unions can also have to. I just want to conclude what they say about the tobacco control bill. They say SAFTU and FAW will also formally request that Parliament halt the passage of a tobacco control bill in its current form. Several provisions risk further weakening legal producers, strengthening illicit trade, and accelerating factory closures and job losses. I quote, we respectfully submit that Parliament should not pass legislation with significant employment consequences without first conducting a full socio-economic and employment impact assessment and engaging organized labor and effective industries. So my question to you is, on this matter, what is the department's response on this letter from SAFTU and FAW? And very lastly, Chairperson, I've said from the beginning that we started with this bill, smoking is bad. Yes, it is. It is very bad. And vaping must be regulated, but under its own bill and regulations. This current bill must be policed better. The current Tobacco Bill Act that is on the statute books must be policed better in terms of law enforcement and the illicit trade. That is my take on what the department said, because Mrs. Hunter said the job losses is not so severe, but yes, the letter from other trade unions who have this concern. Thank you, Chairperson.
Thank you, Honorable Van Schalkwyk. I think it's now the turn for Dr. Lekape, then followed by Honorable Shiro. I seem to have lost him. It's out of the meeting. Honorable Shiro.
Greetings to yourself, Slalo. Greetings to the minister. I don't know if he's in the meeting now. The deputy minister and the team, and
I am.
Okay, greetings to yourself, Minister. Greetings to yourself and the rest of your team. Yes, good to see you. Good to see you, Minister. Thank you so much for the presentation that the department gave us today. Just slight concerns, and I think even the previous members cited some of them, which have been quite, repetitive in the committee over the past few months, if I may, right? And I think there is one point on the Australian comparison that the department provided the committee. And sadly, I think that comparison is just not realistic in the context of South Africa. I mean, even if we look at the bill from Australia, some of the provisions in our bill don't exist in the Australian bill. For example, the Australian one doesn't regulate private homes, just as a start. And second to that, it doesn't also include e-cigarettes and vaping. It's purely based on tobacco products, particularly in relation to smoking. So it doesn't equate the vaping to the smoking part. And I think there is a very big separation. And thirdly, Australia, I think a previous member also spoke to this, they've got a larger capacity for enforcement. And the demand for enforcement is relatively quite low in comparison to the context of South Africa, right? And which is a big deal, because there are countries that have employed similar bill template, if I may, like in Indonesia and Philippines and Russia, and the results are very different from what we are seeing in Australia, for example. In Indonesia, 65% of adult males still smoke. And in the Philippines, young people are still largely exposed to smoking even after these processes that are taken by the government to regulate tobacco products. And at the heart of it, Minister, I want to say, Uguti, we are missing a very important element, which is the cultural perspective. We've seen bills come in and go. We've seen acts signed into law, but not having them have the proper impact that they are meant to have, because they are so divorced from the reality of South Africans on the ground, right? And many reasons are cited in all of this. For example, we have to make quitting easier as a department. Like for now, if I can ask you, if somebody is watching who's a smoker and they require assistance with quitting smoking, what are the avenues that are at our disposal? And those kinds of avenues should be more invested into to ensure that even those who are seeking to quit don't end up being subjected to even dangerous means of going about it. And I'll just give another example. Linda Baleyok regulator lezinto lezi ngendlela efanayo zingafani is might actually be taking us back. The other time I went to a shop myself because loku sikhuluma ngezinto asizazi, right? I went to a shop, ngicela lamo nicotine patches. I don't want to say the brand to give them free advertising. And they give the patch, ngathi chappies, like a small chappies bubble gum of a sort with nicotine on the inside. And it didn't make tangible sense why that would be equated to combustible products. It just didn't make sense, especially for people who are on the route or pursuing alternative means so that they can wean themselves off of smoking. And we need to be considerate of that as well, because that is what the bill ultimately wants to do. We want to see less people smoking. We want to see less health harms that are happening to our people. And I think there has to be a much more interrogative process that takes place with the department and the committee. So it's very pleasing to hear the department saying they are considering some of the changes. I would have loved to hear them, but I respect the order of the process that's supposed to unfold. I really am keen to find out what are some of the concessions that the department is making in this process. And enye into, and I think I've said this quite a few times as well, we can't take away social responsibility from the people that we all agree are causing harm to our communities. So saying, for example, ukuthi a tobacco product or cigarettes must then not provide bursaries to students or must then not do social responsibility programs. I think that is regressive. If anything, we should be increasing them because they cause harm in our communities, for example. So in a sense, if vision department with this bill, we share it. We don't want to shy away from that. We do share it. We want, a healthier South Africa, less people smoking, less younger people smoking. And we all know Guti, laws, if they are cosmetic, they don't have a real impact on the ground. Another example is the issue of drugs and Inyaupe. These things are illegal, but the impact on the ground doesn't speak to that because of enforcement issues, because of the cultural socialization, because of the lack of access to channels that are able to guide people towards a process of being rehabilitated, and also because of socioeconomic issues that survives in the lives of young people. And these are some of the things that we heard also in the stakeholder engagement. So people are saying, but Ininyolusha is literally on substance abuse because they are depressed. And that is an aspect that's directly tied to this department, but it is not something that is being adequately addressed even in this engagement in these processes. And I think it is vital for us to just bring in the human element in how these things really have a direct impact in the context of South Africa. Indaba yokwenza comparison Australia, ngeke isincede ngalutho. Unfortunately, it would be great if we had the same economic status, if we had the same socializations, if we had the same enforcement capacities. Uminister kumele asitshele ukuthi cha, amaphoyisa we-government azofika kanjani endlini zethu to see if we're smoking in front of children. For example, we have got different constitutional obligations and protections on property relations and all of that. And all those things must be taken into consideration so that we know what we are dealing with and what we are okaying. And another example I'll make to the department, the apartheid government had far less laws that were passed in their regime. I think there are 148 in total. I may be due for correction, probably slightly higher or slightly lower than that. And in the post-democracy era, we've had more than 1,500 laws that have been passed. But did they change the livelihoods of our people? Did they result in economic disparities being addressed? Did they result in land being brought back? And I'm saying all of this so that we understand that we have to mirror our legislative approach to how they're going to have impact on the ground. Otherwise, we're just having a cosmetic exercise to tick off boxes because we signed a protocol. when we don't have the means, or rather we're not engaging in conversations and narratives that will directly affect South Africa in our context, in our peculiar context. And I think that is my contribution, Chairperson. I think we will get into the clause by clause deliberations, but I'm more interested in what the department has to say on the concessions that they are made or are considering. And I really hope that we'll be able to collaboratively work to strengthen the bill, because the bill must happen. The bill must happen. We are clear on that. But it must happen in a way that it has a positive impact and does exactly what it seeks to do, which is to reduce smokers. We want to go emakasi wethu singaboni abantwana ababhema emakhoneni, because it's just no longer cool to smoke, because it's just no longer a good thing to do, So ban those once-off single vaping products. You are more than welcome. Make a provision for it in the bill, because we know the primary group or collective that is engaging in those kinds of in the single-use vaping, for example, is young people. Ban the colors. We understand, but ezinye asibuye nganeno and then see what is going to be the real impact on the ground, considering our high rate of the illicit market trade. We don't have to be ignorant to this. We don't have to act like it's not happening. It is happening. And we have to work in a way that goes in the direction to not strengthen the things that we don't want to see strengthen, but particularly to ensure that less and less people are more susceptible to being exposed to cigarettes, are less exposed to being addicted, are less exposed to participating in this whole thing. But the cultural aspect as well. I don't know if the department is open to such engagements on how to strengthen the cultural aspect of decoolifying ukubhema. Thank you so much, Chairperson, for the opportunity. I think the other members have addressed some of the issues as well. I thank you.
Thank you so much, Honorable Shirampungose. Can I give this opportunity to Honorable Khumalo?
Thank you very much, Chairperson. Greetings to all honorable members, our ministers that is in the platform, and also the Deputy Minister and all officials that are present in this meeting. Chairperson, I want just to take this opportunity to appreciate and welcome the presentation by the Department of Health, especially on the issues that was raised by South Africans when we were doing presentation in different provinces. I think, Chairperson, the issue that was key was the issue of the illicit cigarette marketing. I've just saw in the presentation that forward. And Chairperson, in terms of the states, I think colleagues have saw the states presented in this meeting. Chairperson, is very alarming that our communities are dying so much because of this issue of cigarette. So I also appreciate Chairperson the compromising point that the Department of Health is bringing on the table, of which it will assist us when we are dealing with the second phase of this bill. I want just to say, Chair, that as a committee, as the government, we have the responsibility to save life, especially to our youngsters. Chairperson, and I also support, Chair, the issue that the color really, as the department is pushing, I really request that members, we must really support that. people are dying, and also the cost of to the government of people that are sick. And we must also take into consideration, Chairperson, at this committee, that in this country we are not equal. Some of these people that are dying, they don't have even money to go to doctors. So we must also check the balance to say it's not everyone. We are really not equal. Inequality in South Africa is still a challenge. So those will be my input, Chairperson, and thank the department that all issues that was raised in our consultation, they've taken them into consideration. Thank you, Chair.
Thank you, Honorable Kumalo. Honorable Zungula, followed by Honorable Shalangu.
Thank you, Chair. Greetings to yourself, the colleagues, people from the department, and everyone that is in the platform. Chair, I think let me state out clearly as a point of departure that we do admit and we are in agreement with the need to regulate tobacco in our country to ensure that we don't have high cases of people dying and the tobacco causing a big strain on our health system. But having said so, Chair, I think it becomes also very important that we need to address, we can't then saying we are supporting any proposal, even if there is no appreciation on the success of the proposal, on the proposal actually being able to succeed. Because when we create laws or when we formulate laws, it's very important that we make considerations on whether those laws, are they going to be implementable? Are they going to be enforceable? And as the other speaker stated, are they going to bring the much needed change instead of having a law that is just on paper, but practically the laws do not yield any results. Now, on the issue of tobacco, I think for me, Chair, the biggest issue, it's the illicit trade that is sitting at 70% of the total market. Meaning when this bill, as things stand, is trying to address only 30% of the total market of tobacco. Meaning that if there's 1 million people that are providing a strain to the South African health system as a result of tobacco, 700,000 of those are not accounted for and are as a result of illicit trade, which the bill does not thoroughly address. Only 30%, perhaps for now, is being addressed in terms of what the bill. And also, we are not talking, Chair, something that has not been experienced by the country. Recently, there was the COVID ban on tobacco, which led to illicit trade going up. You'll recall that before COVID lockdowns and the respective regulations, the illicit trade was not sitting at 70%, which it is now. There's something, in fact, those regulations, even NGOs or even analysts and other people do admit that the COVID lockdown regulations did lead to a spike to the illicit trade, for it to increase from what it was to the 70% that it is now. So it will always become a real risk to say, if therefore we become or we have laws that are so aggressive towards the law-abiding sector, which is the remaining 30%, maybe the unintended outcome would be an increase in terms of the illicit trade from the 70% to something that is higher. But what fundamentally the department is trying to address, which is the strain on tobacco on the health system, trying to lead people not to smoke will not be addressed. The only thing is that people are going to move from formal legal tobacco into illicit trade, meaning the government is losing out in the sense that the very same people, when they go to hospital, they are going to put the same strain on the healthcare system. So I think for me, Chair, it's just a statement to say we support regulations. However, regulations needs to make sense, and regulations needs to take into account the context in which South Africa finds itself in. And the department's reliance on Australia and UK to justify plain packaging, in my view, Chair, it is a dangerous false equivalence because it ignores the structural reality of the South African market. Abroad, plain packaging was a capstone in markets where illicit trade was sitting at below 15%, whereas if you're to take the South African context, whereby we have got a full-blown crisis of illicit trade that is sitting at 70%. Therefore, to try then to implement this measure, comparing it to Australia and UK, whereby the circumstances are completely different, is a recipe for disaster. Because also in our country, there is no enforcement infrastructure. Hence you find that when we had an engagement with SAPS and SARS, both institutions, they came out to say, whilst the bill might have good intentions, but they do not have the capacity to enforce the provisions of the bill. And therefore, there's a real risk that, even the enforcers or the institutions that are going to be expected to enforce the bill will not be able to do their work. Now, when Australia and UK moved to plain packaging, they had already implemented unique digital identifiers, tamper-proof security, and strict supply chain reporting. Whereas when it comes to South Africa, SARS cancelled a tender that would have implemented the necessary track and trace system to align us with our obligations under the protocol and allow us to take concrete measures against illicit trade. Now, instead of that being fixed, what we are finding in terms of clause 10 of the bill, there's a somewhat weak promise that the minister will support efforts to talk to other departments, meaning there is no tangible program in place to deal with that particular aspect. We only have a promise. And also, the issue of standardizing typeface and color makes packs easily to identify. Whereas in reality, plain packaging strips away the high barrier security features like your holograms, intricate embossing, specialized inks that the different and legitimate manufacturers use to distinguish their tax-paid products from fakes. Therefore, once you remove these technical hurdles, it is, you're creating a heaven for criminal syndicates for them to produce these goods or tobacco in massive numbers because they can blend in and they can grow. And then the other issue I want to maybe ask, therefore, is that why has the department produced a bill to regulate the tobacco industry that completely omits any concrete provisions to combat illicit trade? Why have you proposed plain packaging while ignoring the context of your own international examples, which differ fundamentally to the realities of our country? The other issue here is Ms. Hunter said we are obligated to align with the treaties that South Africa has signed. There I've got a problem, Chair, because I want to ask, therefore, who informs or what informs the laws of South Africa? Is it the citizens who through Parliament and the consultative processes when it comes to lawmaking, are they the ones that inform what laws we use in South Africa? Or is it a matter of a treaty which we signed with international institutions and organizations? And because Ms. Hunter said we are obligated, then for the question would be, what then happens to the bill if what then happens if the bill is rejected? Because if we're saying that we are obligated to align the tobacco control with the treaty, and in South Africa, the lawmaking process, informs that citizens must state their view, it must go to Parliament, parties must vote. If then parties in Parliament decide to vote against this bill, in which Ms. Hunter said we're obligated to align with the treaty, what then becomes the status? And then the issue of domesticating the FTCT. The question I have there is whether have you taken into account different contexts in the country as opposed to the other countries? For example, we've got socio-economic issues, illicit trade, etc. And Chair, I was watching a video of someone who went to Heidelberg after it was announced that BAT will be closing there. And this person who was going to Heidelberg was engaging communities there. And the biggest fear of communities in Heidelberg is how that town will become a ghost town, because BAT was providing employment as a law-abiding company. It was providing employment not only through the direct employment, but also the subsequent employment of services associated with running that particular factory. Now, my biggest concern here is the increase in unemployment when we have companies that are law-abiding closing down because they cannot compete with the criminal syndicates that have taken over 70% of the market. And also, there are some of these clauses that you can see that they are anti-poor. One of them is how the bill currently speaks about, in fact, it is banning the sale of single cigarette sticks. We know that if I go to Ekasi and we have our brothers, our mothers, either running spaza shops or stand apha bathengisa khona, or they are standing by the robots selling cigarettes, they cannot sell a cigarette at 20 because it's not feasible according to the market in which they are operating in. Secondly, they cannot not advertise their product, because if they do not show that they are selling a cigarette, the people won't know that they need to. There's a product that they want as people that they can buy there. So whereas when it comes to the big companies, you find that the bill is less, in fact, it is lenient on such individuals, but very harsh on the poor people who are trying to make a living. And my note here to end my submission, it is just to say, for me, the issue of illicit trade, it is the biggest problem in which we need to address, or the country needs to address. Secondly, the socio-economic conditions of South Africa, they warrant that we need to develop a bill that speaks to the socio-economic conditions. Currently, we've got malnutrition in some provinces. We've got people even committing suicide because they are they are hopeless when it comes to their suffering. They just decide to end their lives. Therefore, we cannot, wanting to solve another problem, but not really interrogate whether another problem can be created, which is unemployment, which will therefore lead to a spike in the incidents that I've just mentioned. Therefore, we support the bill. In fact, we support measures to regulate tobacco, but it must be in a manner that is practical, in a manner that is alive to the socio-economic conditions of our country. And ultimately, we can be confident to say when a certain bill is passed, the objectives of the bill will be met and will not have a case whereby the opposite happens. Ndorivuwa.
Loribuwa, Honorable Zungula, Honorable
I just
Shakubu.
wanted to say that I'm back. It's Dr.
Okay,
Letlape.
okay, okay. You can come in, then you. No, let me allow Honorable Shabangu because he's already on the floor.
Okay,
He
thank
will
you.
come. I was not so sure whether it was his iPhone, it's you.
Yeah, it's
Thank you.
me.
Thank you.
Thank
Honorable
you.
Shabangu. You can come in, Honorable Kape. I see she might be having network problems. She will come after you.
Okay, thank you, Chair. I'll just do a short video for proof of life that it's me. I just have a few points, Chair, not too long. The first one is the issue of harm reduction. I'm not too sure what the position of the department is. I got confused from the presentation as to whether they accept or they reject. But it sounded like in some parts they reject the concept of harm reduction, and I don't know what the concession would be about or the compromise would be about. And just to note that the FCTC Article 1D refers to harm reduction in it. The second issue that follows from that is the fact that if we accept that different nicotine-containing products have different degrees of harm, then there's a need to recognize the differentiated products so that we have risk-appropriate legislation. I mean, in South Africa, we've always recognized that. That's why snuff was taxed differently from cigarette because of the different harmful aspects of the different products. And that is going to be key, because if there's now an acknowledgement of risk continuum, it'll make a big difference to being able to produce a bill, reduce possibilities of legal challenges, and be able to move forward. Would need to be advised by the legal advisors in terms of what the implications are, because the current bill, the way it is written, it's written on the basis of harm is harm. The third issue is the issue of they spoke about choice of retailers, where some retailers have forbidden use of vapes in their places. Some have taken out smoking altogether. If there's voluntary upgrading of the rules, which are consistent with the constitution that the owners are deciding, is the department saying the owners should decide? Because markets would be different and businesses would be different. We've heard from those that run the gaming industries to say in their casinos, that would not work. When we went to Toyando the other day, slept at a casino, we saw that the non-smoking floor space in the casino was much, much less than 80%. It was less than 20% of the available space. So what are we going to do with that? In line with our constitution and the fact that there's the issue of adults, and we spoke about the issue of some retailers making a choice. Others may want to make a choice in the other direction. The department has alluded to the fact that tobacco is highly addictive. Nicotine is highly addictive. And it's been like that even before the new products that we see now. What is the department doing as a Department of Health in terms of helping people with their addictions instead of victimizing them because they are addicted? Where are our clinics for helping people to quit smoking. How many exist in our public healthcare system? We're not talking about talk lines that people can phone, where people can go have counseling directly with somebody. Given that we have about 12, 13 million smokers in our country, how many facilities do we have to take care of those people? The last issue is the issue of, given the history of where we come from, where for not carrying an identity document, you went to prison. This massive, massive campaign of criminalization of a product that is not illegal, when we don't even have that kind of criminalization for illegal substances, it is mind-boggling, given the constitution that we have, where people have a right to earn a living, and people have a right to life, and people have a right to be assisted by a Department of Health, not to be criminalized because they are addicts. So for me, Chair, the key issue is the issue of harm reduction, and we need to hear it clearly from the department, whether for tobacco they think all forms of nicotine are equally harmful, or whether there are degrees of harm. And that Article 1D speaks to the issue of harm reduction in the FCTC. And just lastly, this issue of the convention being signed, it's critical for us to get clarity as to where we at as a country and what is needed. And that signing would be based on what, and what are the implications of signing. Because we can't be signing our independence away. But now that we sign, we have to listen to what the WHO says. You know, you have different jurisdictions. We've been told about Australia, but we've not been told about its neighbor, New Zealand. We've not been told about what happens in other countries. We've not been told about what happens in Sweden. And it is important for us to regulate and pass a law based on the realities that we face, not based on trying to be a poster child for the WHO, when we do not have the capacities of the countries like Singapore that can be autocratic, and they have the machinery and a constitution to back up that form of dictatorship. Thank you, Chair.
Thank you, Dr. Likape. Honorable Fisani.
Thank you, Chair, and greetings to yourself, the ministers, and everybody in the platform. Chairperson, let me join my colleagues in appreciating this presentation that was done this evening. And we also want to commend the Department of Health for the thorough work and the consideration of the recommendations as they were presented here. Because if one remember when we were listening to all the stakeholders at the public hearing, the illicit trade and economic status of our country was a bone of contention. Though if one remembers well, the concern of the illicit trade was largely driven by industry-linked studies. However, Chair, we appreciate that the department took everything into consideration as it was presented. I don't want to re-emphasize on the things that other colleagues have spoken to, and which was under presentation. What is key, Chair, is that the emphasis that the health remain our foremost priority. While having all these challenges, economic considerations, as it was taken into consideration, our economic status, it is important, but it cannot outweigh the health and well-being of our people. Because we know we've discussed, we listened to all the conditions, the disease conditions that results from smoking, which they also contribute to the decrease in economy when people are absent from work. So, but like I've said, that we appreciate all this consideration. We believe that the department produce a bill that is grounded in science. We support this work. At the same time, Chair, I just want to comment on the experience of other countries. That what we get from the presentation about other countries is not irrelevant. But it shows that firm regulation work when accompanied by enforcement and public compliance, which it was also mentioned in the presentation that some of the behavior of people, it's just because they know that they're not supposed to smoke in public, they comply. So these studies that were presented here by they are not irrelevant, but they actually give us the experience that if you enforce the laws and if there is firm regulation of the laws, it can work. And the enforcement challenges, we cannot use it as an excuse. We agree that we have challenges with the enforcement agencies, but it cannot be an excuse for us not to regulate the whatever that we need to regulate as the government. But generally, Chair, a lot has been said and widely covered. I just want to say that we appreciate and we support the work that has been done by the department. Thank you, Chairperson.
Thank you, Honorable Teko. Over to you.
Thank you very much, Chairperson. The team is led by the Minister and my colleagues in the Portfolio Committee, including South Africans. Good evening to you all. Chairperson, my take is in appreciation and support for the presentation that has been made. I liked it when the department is making these compromises based on the issues that were raised during public hearings. Now that there is a mention on how they think they will deal with illicit trading, which was highly mentioned during public hearings, that satisfies me, Chair, to make an example. And also the stance of the department on display on point of sale. I support their stance because it's assisting those that are ready to quit or those that are serious about reducing in smoking. Remember, Chairperson, that when you put something at the point where one is supposed to pay, he or she is done with the shopping, and you put something that he did not buy when he was busy with his or her own shop, you encourage that person to think of that thing that you put at the point of sale. So I support the stance of the department, what they put in trying to prohibit the on point of sale of cigarettes and related products. Also, Chair, I will forever, as a person and a citizen, support this bill, whose objective is to protect people's health, which can result in a saving the money utilized to cure those that get sick because of smoking and vaping. Those savings, Chair, I think can be used to build the capacity of our enforcement agencies that will deal with things like illicit trading. SARS and SAPS did advise us of the shortage of human resources, shortage of resources. Those resources may be there if the money on savings, if this bill can be enacted. One day, Chair, I want to remind this meeting that questions will be asked by South Africans to ask the department, what have you done as a department to protect public health against smoking and vaping? We will be asked as members of parliament why we delayed processing this bill. Also, the interest of the Department of Health, is it not protecting public health? How did they protect that public health? Are there no smoking and vaping related illnesses that you have diagnosed in your clinics and hospitals? What is your plan as the department to curb that? I'm saying that in support of the presentation made, Chairperson. I'm saying that because what is intended in having this bill enacted will save South Africans. I appeal to everyone who is listening to ask the individuals, because I see that the country is ready for this bill. The country is awaiting this bill to be enacted. The hospitality industry is also ready for this bill. I think, Chair, it lies on us as members of parliament to agree with the Department of Health in trying to make this bill an act. It is for us to make it an act. They have introduced the bill to parliament. Parliament is processing the bill. Now we are here at this stage. I think we should appreciate all what they have presented in front of us. That's why I support the presentation. I wanted to say that, Chair, and on that note, I submit, Chair.
Thank you. Thank you. Is there any other member who might have omitted, who wants to speak? Or that was the list? I don't want to. Okay. Yes, you will come, Minister. I just wanted to check members first, because I also want to make an input. Or unless if something urgent, Minister?
Yes, definitely something urgent, Chair.
Yes, yes.
Yeah, my deepest apologies, Chair. I'm on the 8:30 flight because I've got a very early morning meeting in Johannesburg. I'm already at the airport. I've just asked them to delay me a bit until I respond. Is there any possibility of allowing me to respond? And then, because the remaining ones will be responded to.
The team will do that and also will inform you about the way forward.
Sorry?
Thank you. Yes, and the other remaining aspect, the team will deal with that and will also inform you about our way forward.
Yes, because I wanted to respond before you. Yeah.
Yes, proceed.
Okay, thank you very much. Thank you, honorable members, for the inputs. The first thing I noticed, which makes me very happy, is that I didn't hear anybody
sort of speaking in favor of cigarettes, because I know no human being anywhere in this world who loves cigarettes, even those who are smoking them and like them, is because they are ensnared in addiction. They don't like it. I haven't met anybody who praises and say smoking is good. It has never been. And secondly, we know that smoking has never contributed anything to humanity as we think. Numerous studies have shown that cigarettes take more from a country, from its economy, than it ever contributes to that economy. So the issues of jobs and all that, the cigarettes are still going to cost more. It's only that we are talking about short-term gains for very long-term, for long-term, very serious losses if we approach issues in that manner. And studies have been done. The other thing I want to say, colleagues, is that treaties are not enforced on any country. Treaties around the world, including the FCTC, after they've been adopted, parliaments ratify them. Even this FCTC was ratified by the South African Parliament, and only after ratifying, they then count the number of countries that have ratified. Before they make it into law, they don't really push. I also want to add, WHO is not imposing anything on any person. We are WHO. There is no policy of WHO which is just implemented. All policies of WHO, especially those who have got impact on countries, all of them are discussed in the World Health Assembly. The World Health Assembly takes place annually. It's an assembly of all ministers of health who are given equal opportunity. If you don't want something, you say it there. Once it's adopted by WHO, they regard it as having been adopted by the whole world, not WHO alone, because it goes through the World Health Assembly. So it is us, ministers of health around the world, who passed the Framework Convention on Tobacco Control, not the Director General of WHO and his people. The other thing, colleagues, which I want to say, perhaps if you allowed Jeanette, but we accept that she'll come later. Some of the things we are talking about here, like issues of harm reduction, that is not the same, snuff is not the same as others, are the proposals she was going to show you in the new act when she said we had to reach some compromises. In other words, we had to reach some understanding. When we draw the bill, we don't restrict ourselves. We draw it in a way that we think is good and will benefit humanity. But bills are passed into law depending on the agreement of members of parliament. And we're here seeking for your agreement. On the issue of Australia, colleagues, why we're quoting Australia is because Australia is the first country that came up with plain packaging. They are the ones who came with plain packaging. After having done a thorough study, a study that says what? That young people are attracted by branding. Do you think these cigarette companies are spending money on branding for nothing? No, branding increases the attractiveness of the brand. And studies in Australia has shown that once you remove branding, cigarettes have this dirty brown color. It does not attract adolescents who are the people we want to stop from smoking. And after Australia won in their court and by appeal, the matter was taken to the World Trade Organization, not by Australia, by Cuba, who came to us and said we must help them go to WTO because they said they want to use a trade right, not they want to use a trade right and not health issues. And they asked us, and we said it's not going to be possible for us to support them because we have got a huge burden of disease, which Cuba doesn't have. Cuba doesn't have any of the communicable disease anymore. No TB, no malaria, no HIV, no cholera, and all those, but we do have And we told them we can't help them. Small island countries helped Cuba. And when the matter arrived there at WTO, they then said the World Health Organization and WTO must sit together and look into these issues. It took 10 years because they were studying the effects in other countries of plain packaging and reached a conclusion that plain packaging is very good to control cigarettes. Chairperson, unfortunately, I've entered the plane now and they are looking at me, they are about to leave. Can I leave this to Jeanette and the Deputy Minister? I'm sorry, Chair.
Thank you so much, Minister, and you must have a safe journey. Your input is also welcome.
Okay.
Okay.
Thank you very much.
You can mute Minister or log out. You can hear what's happening in the background. Okay, we are fine. Before the minister interjected, there were issues that I also wanted to raise so that Jeanette and the deputy minister and when you respond to, then you can also look at that. Is the issue around the protocol on illicit trade. Jeanette, you will recall that there's been a cabinet decision on the 29th of April that gave the ministry a directive to table the protocol to eliminate illicit trade on tobacco products. And then that means that the executive on that part had played its part because that's what normally happens to say agreements that require ratification. There has to be the approval of the national executive, it being the president and the cabinet ministers. That was done in 2015. And then at the same hand, if you read section 231 of the Constitution, it is very explicit that international agreements falling within, they require parliamentary approval before they can bind the Republic. I'm reading this on this slide of yours that talks about the protocol to eliminate illicit tobacco products. You've put it in bold letters that this is a legal international treaty aimed at eliminating all forms of illicit trade. But then we all know that this has not yet been ratified by Parliament. So I should think you need to correct that, because if you read section 231 of the Constitution, it's very clear that international treaty must be ratified in South Africa. Yes, Parliament has ratified the main protocol, but this one to eliminate illicit trade in tobacco products is not yet ratified by Parliament. And then one is asking ourselves a lot of questions to say, since 2015, when the executive had given you that responsibility, because what was supposed to do, it was for you as a department to write a letter to the speaker and also the chairperson of the NCOP that indicate that you are doing the tabling of this protocol in terms of section 231(2) of the Constitution. And then that letter was supposed to be accompanied by an explanatory memo which set out the history, objectives, and implication of the agreement, and a draft resolution that must also accompany the tabling of this agreement that had to be approved. And in a normal functional agreement, this agreement was going to have been forwarded to this portfolio committee on health, including the select committee in the NCOP, and then that's how it's done. So this thing to say this thing is legally binding is not under the circumstances, and I think that this is the inconsistencies that you need to clear here on the presentation. And then You cannot refer to things that are not law and you say it's law, because until this protocol is domesticated to here in the country, then it's not legally binding. So that's the issue that one will have to ask, because unless you prove it to the contrary, and then because we have tried to ask our researchers in Parliament to look for this. As far as we are concerned currently, this has not yet been ratified. And then it means that at the same time, because if it has been ratified, so I think I'm happy that you are further raising it to say this. If you go to the next slide, now you are further saying that the South African Parliament must ratify the protocol, which is already binding globally, and it has been ratified. So it contradicts what you said earlier, that is legal binding. So can we attend to that, and maybe the committee be given a report as to what happened since the National Executive took a decision in April 2015 and up to now, this process of tabling the protocol and the agreement in Parliament is not done. Because under the circumstances, we ask ourselves to say, because this protocol is not yet ratified domestically, how will you track and trace the system in order to be legally supported? So these are some of the issues that I want you to talk to. Secondly, the issue that I want also to talk to Jeanette with regard to this issue around the protocol. You'll recall that there was a presentation by SAPS and SARS to the committee, wherein they were raising these issues also of enforcement. And then they have raised things sharply because SARS and SAPS are the leading enforcement agencies as identified in the bill. And then in their presentation, when one goes through it, they confirm that illicit trade is out of control. And then they also indicated that additional resources are required to enforce the current legislative provisions. And they also warn that if we expand this legislation provision without additional resources, it will lead to even a more weakened enforcement. I don't see it in your presentation wherein, as Honorable Clark has raised this issue, how are you then addressing that? Because it's a fact and it was part of the public participation process, because I would have loved a slide that responds to those issues as raised by SARS. And then I'm glad, as you are cutting short in the presentation, that there are changes that you are proposing that came out of the public hearings and the oral representation with regard to product differentiation pertaining to plain packaging and illicit trade. And then you also say that you are willing to differentiate non-combustible products with regard to the plain packaging and labeling. So that's why we are saying that if that is the case, then I should think, as and when you go back, can you come up with an undertaking that you then gonna provide clear definition of combusted and non-combusted products? Because this is very important to make sure that there is a clear categorization of tobacco and nicotine products based on their risk. And then I should think also, when one looks at the definition of smoking, this is something when you, after you have differentiated, then it's gonna be different, because combusted products, there are those that you smoke, and then there is also use for non-combusted products. So these two definitions of smoking that relates to combusted and use that related to non-combusted products, it should have then come clear. And then also, we are all supporting the bill, but the issue is that we just need to be clear, because when you legislate, we need to make sure that our legislation is clear, straight to the point. It doesn't lead to ambiguity. So it's very important as and when then you write the law, you need to also address those issues. And then the issue that I also want you to talk to is with regard to the dedicated resources that you are going to allocate to the multi-sectoral task team. That is your SARS, Treasury, Border Management Agency, SAPS, including yourself for the effective implementation and the enforcement of the protocol once ratified by Parliament. And then also, under the circumstances, then we want to also check what specific training and communication, as somebody raised, strategies that are planned for the law enforcement, health inspectors, and the public to ensure that there is a comprehensive understanding and compliance with the new regulations. So these are some of the issues that as and when, because this as one read what the comments of the people that they've raised, those four in particular as well, they've raised some of these issues sharply, and then we would like you to also then, as Honorable Shira Mpongoze said, as you conclude, to say, when you come back also, you need to also then to seriously zoom in and highlight these issues that you feel out as a consequence of the public consultation, and also as a consequence of some of the persuasion. There is a consensus that you are making in the process. It will be important and key for you to list those, so that then we are going to then to be able to say, to isolate them, because what we need to do here, we are all saying we want to strengthen the bill. Everybody agrees that this bill must be strengthened. And then with regard to, that's why we're saying, let's then reflect regulatory proportionality also when it comes to the issue around plain packaging and strong health warning, including also the issue around mandatory health warnings for non-combustible products. So that's why we need to also then, we can then work on this, and then we are all saying, at least it's in your own way to say, you cannot divide the bill. It means there are issues that you can also include. So when you come back, based on the members' comments, then we don't even believe that you can divide the bill. The bill at one must be able to address all those issues that feel it will be strengthened, because we cannot then do some a legislative fragmentation by dividing. The reason why you legislate, and because with time, as time evolves, you need to make sure that you cater everything that has to be legislated for. And then I should think, under the circumstances, I'll hand over to you so that you respond to most of the issues as raised by members. And then we can come back at the end with the way forward as to how do we progress from here. Over to you, Jeanette, DG and team, and the Deputy Minister should come last, definitely, after all of you. Over to you, Jeanette.
Thank you, Chair. Can we just check if Deputy Minister and DG is in agreement that I go, and they'll maybe sum up in the end?
Proceed,
This is
Chief.
how it's done,
Yes.
Jeanette. They will come at
Thank
the end.
you. Thank you, Chairperson. So I will start right at the beginning with Honorable Matubatsi. There's nothing to comment on the comment from this honorable member. It is like Minister, when he started, he had appreciation. I also want to say thank you. I've heard from every member who spoke that they support regulation of tobacco and related products. And mostly what I've heard from Honorable Matubatsi is these are things that we are in agreement with as the department. With Honorable Leroux, I just want to respond to the question on whether the department looked at research and what does the research say about the current increase in smoking among South Africans. And we certainly have, because it is a concerning issue. There's research done by the University of Pretoria that they published in 2024, and I'll share the link in the chat in a while. And this research shows that 60% of the increase is due to access through hubbly bubbly, the water pipe smoking, and vapes, and also the normalization of nicotine use through vapes. There's a minor percentage that is attributed to easier access through cheap cigarettes, and we take it that cheap cigarettes are the illicit cigarettes, and it is therefore incorrect to attribute the increase in smoking to illicit cigarettes as a main cause. And if you look at the findings of this study, it's exactly what the bill intends to do is to decrease the access, easy access for the youth, and as Honorable Khumalo had mentioned, the content of the bill is science-based, so we looked at the science in drafting this bill. Then the main point for me made by Honorable Clark was about job losses, the concern around job losses. And we do say that South Africans have to be healthy first before they can work. And there are examples of countries that have moved to different crops, and examples of countries on the African continent that have moved to healthier crops that do not compromise the health of its people. And there's research that also shows that, yes, the country can move into investing into different ways of livelihood than to keep on engaging with an industry that causes harm to people's health. So that's the response to the job losses. Also, in relation to Honorable van Staden mentioning Saftu's letter, and that's our response to the issue of the job losses. South Africans have to be healthy first before they can work, and there are healthier alternatives in terms of industries and even agricultural crops. Honorable Charwa was also expresses support for legislation, and she raised the issue of the fact that comparisons with Australia is not realistic. The Minister explained why we use Australia. And I also just want to mention the issue of private homes is just when private homes are used for business, when private homes are used as creches. But these are also issues we could look at the time when the committee instructs that the department could give their input in terms of their compromises. Yeah, Honorable Zungula, the main point for me there was what he was saying about branded cigarettes, the fact that branded packaging allows you to tell fakes. Plain packaging can do the same because plain packaging can also have the different insignia where you can then determine whether the product is legitimate or not. The Minister explained the position on the treaties, and let me from there go to the chairperson's point. Honorable Mutambi's point, we've taken that point. Our legal officer is present, and we will certainly prepare that report and send it to the committee in terms of what transpired after 2015 and what we see as the way forward. Then, to respond to Honourable Letlapi, no, clearly, we've had this discussion in NEDLAC. We had a whole day in NEDLAC dedicated simply to presentations on harm reduction, and so the department has not changed its mind. In our book, the research shows that nicotine delivery systems are harmful. The levels of nicotine in vape might be lower, but people vape more, and they take in even more nicotine. And the huge danger in nicotine is the fact that in vapes, the huge danger in vapes is the fact that the industry is trying to normalize it amongst people, but to normalize it especially amongst the youth. So our position is still that vapes are harmful. However, and this is why we use the word compromise, the minister also explained that we want the regulation to protect the people of South Africa, and that there are compromises we will have to make. So it will be a compromise, Honourable Chair. It will not be that the department has changed its position in terms of vaping and other nicotine delivery products being harmful. Yeah, then what is the department doing on smoking cessation? The one weakness that we have is that we do not offer replacement substances yet, but we do offer counseling in all our clinics. We motivated for, and we got a special grant from Treasury to appoint more psychologists and registered counsellors to our primary healthcare facilities, so that counseling on different mental health issues, including addiction, can start at the primary healthcare level. Chair, those are the issues that I want to respond to. And as I said, your comments in the end, our legal officers present, we have listened to you, we have heard you, and we will certainly provide that report. And also, I've noted the issues that you said we should do when we come back, when we are invited back to this committee. Thank you, Chair.
Is there any other, DG, any comment before I hand over to the DM? DG?
I don't seem to see him, Chair.
So you can shoot DM.
Well, thank you very much, Honourable Chair and the Honourable members. Thanks for the engagement, and let me also add my word of appreciation to the fact that clearly it's more on some of the details where there's differences, but the overall kind of intention to deal with the issue of prevention of harm rather than treatment after the effect has overwhelming support. I think there are differences on some details. And as already agreed to, at the next stage, the department will be invited to present, will be guided by the committee in terms of whether during the time of the clause by clause or at whatever stage where areas where we would indicate, because the bill now is under your stewardship, where we'll indicate areas which as a department, we would support and propose certain changes which accommodate, including some of the points raised here, and also from the public comments. Just overall, honorable members, I know a number of members raised the issue of enforcement, including also whether, as already, I think the chair, you also, I'll come back to the issue of illicit trade. But just overall, I think a number of honorable members raised the issue of all these provisions with already a highly burdened police service. How is it expected that they will be able, these regulations will be actually implemented? I mean, one would say that almost similar to the current legislation provisions. And now and then when we discuss this with our first minister, former minister Dlamini Zuma, she always reminds us about the serious resistance even at that time, and also major arguments about the fact that all those prohibitions which we have become accustomed to actually were seen as impractical, and that, you know, there would not be the capacity. But she often says that her response, and which I would say, even in terms of many of the changes which have been proposed are still relevant, was that a lot of this, once society actually internalized the fact that the law protects them, over and above reliance on the police, you know, the society in itself, in some of the areas, will actually be the police. Now, but also on top of that is the fact that a lot of this, you know, also is going to be dependent, similarly with what we have now, on the industry. If we talk about issues like plain packaging, in terms of content, when we say that in terms of the electronic systems, there will have to be regulations, including sales to minors. Many of those, you know, on the one hand is the traders, the manufacturers and the traders, because if we talk about a particular requirement in terms of how the products should be packaged and produced, that is the onus on the industry at the level of production, at the level of distribution, and at the level of sales. Now, I mean, all those are regulated and licensed. So if you go against the conditions of your licensing, it's not even the question of the consumers, the end consumers, but you know, you would know that if you go against the conditions of your license in terms of that product, your license can be taken away. So some of those will not even require, you know, boots on the ground in terms of police moving from, you know, that value chain, but in terms of just ordinary inspection, as it should be on various products. So I'm just saying that it might look onerous, but experience tells us that because of the fact that various role players are actually regulated and work on the basis of licensing, many of this will be doable. If you talk about doing away with smoking areas in public areas, many of those work under particular licensing and regulations, whether it's entertainment, whether it is in terms of hospitality. I mean, they work on the basis, if your license condition says that you can't have additional space for smoking areas, You can't have a smoking area at various outlets, whatever you operate. That is the case in terms of your licensing condition. So I just want to say that we might be alarmed in terms of enforcement, but experience tells us that, in fact, it can be done. I would venture to say, even though Jeanette has explained that in terms of the protection of children, even in domestic areas, it's more in terms of those which are used for some kind of public use. But I would venture to say that, for instance, we have regulation, we have law in terms of alcohol sale and also consumption for underage children. But you can only regulate at the level of sale and at public areas. But because of the fact that society is aware that for underage, not just sale and distribution and even consumption is wrong. Where we're all familiar with the situation, the uproar which happens. Many of you would be aware of not long ago the video which went viral, where some parent was actually providing alcohol to children, and it was members of society who made sure that this has actually become known, so that action can be taken. So in the event where certain complications and certain things come to be known, if there is particular regulation which says, even as a parent, you are obliged to protect even your own children, even in your domestic area. It doesn't mean that there's going to be police knocking to check whether you're doing it. But when certain things happen, when there is law and legislation that it's illegal to do that, then action can be taken to protect. And I think a lot of those. Maybe lastly, Chair, just to say that on the, I think the issue of illicit, we have heard, I think as Jeanette has said, that we'll go back and just check the compliance in terms of whether actually there was, because you're correct. It's the protocols and all have to be, passed by Parliament. I think the team in coming back will come back to that. So in terms of, I think Honorable Dr. Letlape did ask the question as to whether we actually have the facilities enough in terms of the rehabilitation. The reality is that indeed it's very costly. Some steps, as Jeanette has indicated, in terms of counseling, but some level which can be taken in terms of assisting those who are already addicted. But this is quite a costly exercise, as we see also with hard drugs, that we rather put more resources in the area of prevention, because once people are addicted, it's a lot more difficult from in terms of, from a medical point of view, in terms of assisting people to stop the addiction. So thank you very much, Chair. Thank you for the opportunity, and the issues which have been raised, those which need us to come back, will definitely do so. Thank you.
Colleagues, before I wrap up on the way forward, is there anyone who wants to comment based on the feedback from both the ministry and the department? If none, I'm trying to check hands. Then it makes me to then propose a way forward, or determine a way forward under the circumstances. Yes, I'm glad that everyone is committed in making sure that this bill sees the light, but there are issues that we still need to attend to, Jeanette. As you've heard, the issues as raised by the members, and I should think if then you can go back and polish all those issues that raised then in a format of a revised presentation, and you also providing all the necessary information as requested. Then I should think then because the next step for us as a committee will be to consider and adopt the motion of desirability of this bill. But we can only do that once all the concerns is raised by the members are addressed. And I'm glad that there is a commitment that you are going to attend to those issues. And then at the same time, then you still have to come to us and show us all those matters that you feel that there's consensus that need to be attended to. And I think the message that you must go home with tonight is that it will be very crucial for you to distinguish clearly between combustible and non-combustible products, because we all know that their risk profiles differ significantly. And then the other issue that you need to also then to go and look at the distinction with regard to the issue around harm reduction. I'm trying to summarize what the members were saying, and the public health improvement. And then if you provide clear definition of the product categories, and then you tailor regulatory measures as to you are doing in respect to the risk, and then I should think this bill will be able to ensure that we have more stringent control, such as stronger health warnings and public use bans. So under the circumstances, that's where we are saying that this bill must then incorporate explicit differentiation between combustible and non-combustible. And I think the beauty about it, you have heard the attitude of all the members here that they are all in support of the bill. The only thing that they are saying, incorporate all the issues that have been raised in the public participations, and then we can move forward. Having said that, I should think Deputy Minister and the team, one will arrange a meeting in due course where Jeanette, you will come back, having incorporated all the inputs and concerns is raised by the honorable members, because it's in our plan that this motion of desirability has to be considered and adopted by this collective of the members of parliament. And then that can only happen once you have then addressed all the issues that the members have raised and concerned. Then we can then adopt this bill when you have also cleared the language, and then also the issue around reinforcing enforcement against illicit trade, and then also we need to, and then also then be clear in the language if we are defining harmful and less harmful. What is it that you're trying to say? So these are some of the things that we will then wait for you to come back to us together with all your concession. Having said that, I should think I can excuse all that are not members of the committee so that we can continue with the committee business. We've got a program that we need to attend to. DM and team, you are free to leave the meeting so that we can proceed with the other business of the committee. Thank you, everyone who attended.
Thank you.
You are now excused, except for those that are members of the committee that has to deal with this other item on the agenda.
Thank you, Chair, and good night.
Okay, you will hear from us then, Jeanette, on the date. Thank you. I'm waiting for those that need to excuse us to leave. You know yourselves, I cannot call you by names. As they are moving, colleagues, the next item on the agenda is the adoption of the committee program. Can I ask Secretariat to flight it? Lindo? Puyo? Can we do that? It's late now. We're counterproductive. Members, I believe it was also sent to you on your emails. Can I, in the meantime, be going through it so that we can then attend to the issues as raised? There are those events that is, today we're on the 25th. Then the 4th of March, with the latest development, I should think we can reconvene the department to come back and talk to us on this presentation that we're dealing with. But yeah, and then we can shift these items that are on the 4th to a later stage. That's what I'm trying to talk to you as going through the agenda so that we can see that we've got an outstanding issue. Then, yeah, that's how it is. And then the plan was for us to deal with this other item on the 11th of March, depending, so that we can deal with the consideration and adoption of the motion of desirability of the bill. And then if then that goes on, then we can then start from the 12th of March to deal with the clause by clause deliberation of the bill. And then on the 17th, there was this issue that has been long outstanding on your agenda, briefing by Dr. Leclerc on the private member bill. It has formally been referred to us by the Speaker. And then also continue on the 18th to deal with the clause by clause deliberation on the tobacco bill. If you see, colleagues, we are in those days that we are putting the 17, 20 to 2030, it's when there are also cabinet days to accommodate the minister. The minister has requested that he would love to be part of the meetings, and then as I discussed with the House Chair, he told me that we know the rules if then we want seriously, because he's also committed that we need to process these things, then we can always apply to then work after the sittings. Yes, and then that's how it is. If you see those are the dates where also there are sittings during the day, because with the time allocated only for the committee, I think the time is so limited such an extent that we couldn't do justice to all these issues that we want to deal with. So you will see this term mainly is all around the processing of the bill. Then under the circumstances, then I can note the hands. I was just summarizing so that you see. And the proposal for the 4th of March that we call back the department. Honorable Mtuwatse, followed by Honorable Clark.
No, thanks, Chair. Chair, there's an issue that came out recently on the suspension of the implementation of the NHI by the president. I don't know how we're going to deal with that thing. We'll deal with the issue at Parliament as a party at another level with the president. But then of interest, I would want the minister, as a matter of urgency, to come and explain to us what does this mean, because surely if cabinet have reached this decision, which is illegal in its form, I think we have reached a stage where now the president is condescending not only on the work that we do, but he's just condescending on Parliament and the country as a whole. And this is upset. We've reached that stage because you can't have a situation whereby there's no court of law that have ruled on that matter, and out of the blue we find this all over the place. So I think if I'm missing the point, I need to be assisted by members. But I wanted to suggest that perhaps the minister, because he's the one he must come and explain this to us as a matter of urgency. I think if possible, that should happen by next week. We can find a date next week whereby we can come and get that explanation. Thanks, Chair.
Noted. We'll process them accordingly with the other views of other colleagues. Honorable Clark, followed by Zungula, by Liru, and then Verstaden, and then Cheko.
Thank you, Chairperson.
My
Is
hand
it-
is also up there. It's Falco. My hand is also up.
Yes, I've indicated that you're going to come after Honorable Van Staden.
Thank you, Chair.
I've noted you. Honorable Clark?
Can I continue?
Yes.
Chairperson, I am unfortunately going to have a problem with some of these dates because I sit on 4 committees. And in particularly the Joint Standing Committee of Parliament also meets in the evening after sittings. So I don't know if I'm going to be able to attend all these meetings in the evening because I've got to go to other committee meetings as well. So, I mean, can't we look at having our meetings on a Tuesday morning? Because it really puts me in a terrible situation now because between health and my other 3 committees I'm on, I don't know when I'm going to find the time to do all these things. Thank you.
That's a consideration that you are trying to raise as well. Also bearing in mind also that majority of members that are here on Wednesdays, they are also full-time members in other committees on Tuesdays. But we'll see how do we reconcile it to an extent that we'll have to address and attend to each and everyone's concern. The Joint Standing Committee on Parliament, I think it has got particular dates. Maybe you tell us when is it meeting so that we can start to align that as well. Honorable Zungula.
Thank you, Chair. The program, I think I want to raise the manner in which it is written now. I think it is preempting that the desirability of the bill will go through. That is why there is then provisions for the clause by clause. I'm not sure whether that is the correct approach, whereby there needs to be, whereby it is preemptive like that, because if the bill does not pass through the desirability stage, therefore there's no clause by clause that will be needed to be done. So that's the first issue. The second issue is that there was a couple of organizations that wrote to the chair, workers' organizations like SAFTU, that wanted, and companies that were affected by the issue of the illicit trade, put aside what the bill, whatever process the bill is going to deal with. But I think meeting with those organizations which requested an audience with the portfolio committee on the issue of illicit trade and how directly the workers are affected, I think that's a key priority the committee needs to consider, that we need to meet with them, understand the real impact in terms of their lives, their livelihoods, and the general well-being of communities. And then there's the report that was presented by Advocate Ngugai Tobi, which is the racial bias in the medical aid schemes. I know the minister did table that report to the committee last year, but I think it's critical that as a committee now, we develop an action plan, see if perhaps there are gaps in terms of legislation, see what could be done to really prevent any other action by these companies and individuals that are still having racial stereotypes against Black healthcare providers. The last issue is the issue of the NHI. I do want to echo the sentiments of Honorable Mutubatse to say the committee must receive a briefing from the minister. And then after receiving a briefing, there must be an engagement, on what then is the way forward or what practically will happen given that the president has postponed or stopped the implementation, because it's something that is unprecedented. There's been cases whereby people go to court for one reason or another without a court order. We've never seen government saying that they're going to stop doing what they're doing even before a court of law is pronounced. So in this case, it smells of undermining the will of South Africa, of people of South Africa, because there were public consultation processes, public hearings, which gave a mandate on what needs to be done. And without a court order, that says that must stop. It can't be now that, the executive is going to undermine the work that has been done by this committee and parliament. Thank you.
Chairperson, can I have a point of order, please, Chairperson?
Yes.
The court has ruled that the NHI must be suspended temporarily because of the issues that are with the litigative issues that are in with the court at the moment. So it's a court order. It's if you look on the group, Dr. LaRue has posted it. So it's been done through the courts. Thank you.
Chairperson, if I can just help here, that's why I raised my hand in the first place, is to help with this matter. If I can continue, please.
Okay.
Now, the NHI is currently sub judice. There's 10 different litigation cases currently before the High Court and the Court simultaneously. Now, this ruling was done yesterday by the High Court in Pretoria. And like Member Clark now said, it's a court order. It must be adhered to, and that's where the president's decision is coming from. So we can't entertain this matter before the court hearings is not settled. Thank you.
Okay, but what I had...
No.
Sorry. Let's not generate the meeting. You need an update so that the minister can brief the committee what is happening with regard to all these issues so that everybody's on par. That was the understanding with all this other stuff that also Honorable Zungula. Yeah, it will be important so that we're all at par because there are also various court judgments. Also, there was also that issue to say the Concord is going to only hear now the public participation matters. So for members of the committee to be taken on board by the minister with regard to the whole thing without getting into the merits of the case because the case they are still subject to care. That's the understanding. Am I right, Honorable Mtuat?
No, thanks. Mr. Chair, we must not confuse things. Members are correct. The court order was issued yesterday, isn't it? So that court order was issued yesterday. When did the president suspend the implementation? He suspended it before the court order. Last week. And that's my point. So put that aside. Put that aside. But I'm saying the minister must come and brief us. What is happening with the NHI, inclusive of, we've been dealing around hearing things about the national health insurance. This is what is happening. This is what the department is doing. This much has actually been spent, but we have not been taken into confidence by the department to give us an update. And I want this committee, I'm suggesting that this committee must have a comprehensive report on what is being spent, what is happening. Now, this president, last week, he just go and suspend this matter. So now that they've realized that there's an issue around this matter, they quickly go behind closed doors to say, we're caught with our pants down. Now, what we're going to do, we're going to immediately have this matter ruled by the court because they know that what they've done is wrong.
Honorable Mtuatse, I
thanks,
think
Chair.
you made your point. These other things are not necessary.
Okay, thanks, Chair.
Read that the minister will come and brief and update us with all these matters without even getting into the merits of the case so that we can be able to deal with that issue. And these other issues that, that's how I should think. I was trying to to address the order in line with what the colleagues were saying to that effect. Honorable Shabangu, followed by Honorable Liru, then it will be Honorable Keko in that order. Honorable
Thank you, Chair. No, Chair, I just wanted to say I agree. I see this program is relevant depending on the progress of the bill that we are dealing with. And I wanted to indicate that we live as is. We cannot change it because I want to believe that most members that are here, they are serving in many committees. Tuesdays, we have other committees that are sitting. So if we change, we'll start causing chaos to try and accommodate. We'll have to juggle around and maybe see how we can attend the meetings. Otherwise, I'm okay with the program as is. Thank you.
Thank you. And then there was an issue before I allow Honorable Ro to talk to Honorable Zungula. We are not preempting the outcome of the motion of desirability, but this is how programming allows us to expect us to do. If the desirability is not passed, then it's still okay. We will remove those meetings, but we need to plan as per the requirement by the programming committee. So that is, then we'll find other items to put in there. If that is to allay your concern, but that's what is expected of us to do it. Thank you, Honorable Leroux.
Thank you, Chair. I just there's echo now. Apologies. Okay. I'm on my phone as well, so maybe this works better. Can you hear me now?
Yes. I can hear you.
Oh, see, here we go. So, Chair, just had two questions. One is, or two requests. One request is that I see that most of the meetings so far have been scheduled as virtual meetings, and Can you hear me?
Yes, we can hear you.
I'm not sure if you can hear me.
We can hear you.
Oh, good. So I see that the meeting is much be scheduled as I wanting to request that we could perhaps. I think it is always more productive to be in person if we are able, and particularly the Wednesday mornings, if at least every second one of those meetings could be in person, I think that would be important. So that's a request that I'd like to put out, especially now that we are in the house most afternoons, and most people need to be in Cape Town on Tuesday, Wednesday, and Thursday. The second request was just perhaps to consider, in line with Honourable Clark's request, where there are clashes with other committees, whether we could not consider to try and keep most of them into that slot on a Wednesday. I understand with the phrase by phrase, line by line, we do need to push that to some extent, but if we can consider trying to keep our out of times as much as limited as possible, because it does put pressure on some of the members who've got other committees. Then the third question I just wanted to get clarity on, and perhaps you could guide us, but from what was spoken about today, where there are some amendments that the Department of Health are prepared to make to the tobacco legislation, what is the process of accepting those amendments? Will that happen after the clause by clause, or does that happen before we have our motion of do we need to see that before we have the motion of acceptability? So what exactly is the process for allowing and accommodating proposed changes that they have made as a result of the tobacco hearings? Thank you.
Okay, ideally what happens, post the public comments and their responses, because you heard them saying that there are matters that they need to consider on. Based on that, then we can then make a determination whether we are considering or adopting the motion of disability. And then post that, then that's when we still have ample time to go clause by clause deliberation on the tobacco product. That's where they will come in, and then as MPs now, then you are allowed to then deal with them. And then after that, at the end of the day, you will have an opportunity at the end whether this bill should be adopted or whatever. Then those are the processes that goes through that. So these are some of the things that, but disability then is giving us a go ahead to proceed. Because what is the point of going clause by clause, whereas then you've not just passed the motion of desirability? So it doesn't mean that when you pass the motion of disability, then at the end, it compels you to adopt the bill. That's why it gives you an ample opportunity to go clause by clause, and then that's where that's where your lawmaking process, Honorable Clerk, Lero starts. Because at the end of the day, after those clauses, then you have got a view that you need to raise. That's where now your lawmaking process starts. So what is happening currently is the baseline. They're indicating this is the bill that we're processing, but at the end of the day, it's this collective that has got a final say. And when we do that, that's why we're saying when we legislate in the public interest, we need to make sure whatever we do is in the best interest of the public. We mustn't come with a vague provision. We need to make sure that our definitions are very clear, precise, and to the point, all those sorts of things. Honorable Zungula, is it in relation to that, or can I allow Honorable Keko to first come, then you can come thereafter?
It's just a question on what you just said, Chair, whether then the motion of desirability, is it on the current bill, the one that we have on paper, or is it now including what the department says they are willing to compromise on? What exactly will be put to a vote or put to a test as being desirable? I'm just failing to understand that part.
The disability is simply means that we've got a problem, and then we're bringing in this law to resolve the problem. And I think listening to you is just that the form that you are saying certain issues are not identified, but we all agree that there is a problem. Then we can go ahead to continue to deal with them clause by clause. That's why, Honorable Zungula, if you feel this clause is not properly crafted or whatever, you also have got a right to also comment and input on it. Okay, we are fine. Then let's allow Honorable Fleko.
Thank you, Chair. Chair, I've raised my hand to support the honorable member that suggested that let's agree and approve the program as tabled. But I wanted to add a clause that says let's approve it as a living document, so that when there is a challenge, we address that challenge, like what Honorable Ntobatse is suggesting. On the issue of yourself, of us inviting the minister, we may just suggest as soon as possible without fixing a date, but as soon as possible, as that when you see that we are able to get the minister, because we may say next week, when you contact the minister, you get it that he is not around or both of them are not around. Let's just put as soon as possible and adopt the document, the plan, as a living document. I wanted to suggest that, Chair.
Thank you, Chair. Thank you. And then we note the issues that members have raised, like the issue of the minister to come and update on the NHI, also the issue around the Section 59 report on the racial discrimination. I should think we will also put that also to consider the issue of the availability of the minister, and then also that issue of honorable clerk that is raised. We'll see how do we then deal with all these matters. But I then got Honorable Clerko moving that we adopt with the proposed amendments that will be infused and sent back to you, so that this is how we are trying to see that we infuse some of the issues that you have raised. The minister has shared with us the schedule of cabinet meetings, unless if he's traveling, because cabinet was today, it means next week Wednesday the minister might be available, unless if there are any other pressing matters. That's why maybe we can also then, when we deal with the updated responses by the department, then we can slot in this issue of the minister also briefing us, giving us an update on what is happening around the NHI, including the legal cases, without getting into the merits of the case, so that we are all on par. That's the issue. And then the day when we call the CMS, Council for Medical Scheme, because also we can also ask the ministry to also put the report, the progress report. He has already shared this report, Section 59 report on racial investigation. That's the method that we can also insert there, so that, because also the Council for Medical Scheme is also involved on the other matter of the Section 59 inquiry. So these are the methods that we can then consider to deal with. Then the issue around people writing to the chair with regard to the bill. I think, colleagues, you must agree that we close the public participation on the bill. But at the same time, there are issues that there are matters for engagement that we can engage people, especially with regard to the issue of the illicit trade and enforcement. That one, there is also the issue that this is the prerogative that we need to then retain and engage stakeholders, and then also the issue for us to then also engage the government, so that they must also then be visibly proactive in addressing enforcement. So these are the matters that I should think, Honorable Zongola, as and when the issues come. I think because the issue of jobs, if you read the subtle letter, is not a one committee member matter. On our part, the reason why we cited in particular is the issue around the bill, them asking us to stop the bill. And then that is undesirable, because we had gone through extensive public participation, and then we were still busy in the process to then consider the bill. But in the current form that they've raised, I think these are the matters that we were trying to solicit today with the department, to say they need to look at that, so that it addresses also their concern. But yes, it's a point, because remember, when people write to Parliament, they understand that Parliament is their voice, and then their issues has to be considered. But we'll look at those issues as and when they come. Yeah, then we can attend to them. Yeah, there's nothing that also bars us from listening to them, as long as we are not reopening the issue of public participation. One is comfortable with that. Yes, then do we have the minutes? The program will be updated as per your proposal, and then it will be forwarded to you. Then we'll also then finally sign it off and send it to the House Chair for consideration. There's also minutes that of the previous meeting. I believe they were circulated, because the more we keep them, we lose track about what we've decided, and it helps us as and when in the next meeting, then we consider the minutes of the previous meeting. It also helps us to then have a tracking register and to follow up on the issues that we raise. Are the minutes ready, Secretariat? Yes, those are the minutes. We had a meeting on the briefing by the minister on contingency measures following the ARV suppliers under business rescue. We seem to have been full house, all of us were in the meeting. Then also the colleagues from the department, they were there. Then those are the colleagues who moved for the adoption of the agenda. Then that is the briefing by the minister. Stop there. On their consent, they are there. These are the issues that colleagues you've raised. There is our resolution. So I had also asked colleagues with regard to the last bullet to say those of you who felt your questions were not adequately responded to, can we get those questions so that we forward them to the department? Because this is the matter that's outstanding that we need to come up with a recommendation at the end. So these are the minutes. So can I get an indication from you, Vuyo, and the colleagues, whether the colleagues have submitted their questions so that we need to at some point to close this matter and take a resolution in terms of the, yeah.
No, Chair, I haven't received any submissions. Thank you.
Okay. What does that mean, colleagues, if I may ask?
That means we are satisfied with the minutes and I move for adoption, Chair.
Thank you. Any seconder? Then that issue of questions will be a matter of arising.
I do second, Chair.
Seconded. Then we'll put it on the resolution register that is an outstanding matter on this matter. Then we'll discuss it at a later stage. Then the meeting thus adopted. Yes, it's 21:13, colleagues. One would like to appreciate your commitment. You see, here you work and work. There's no compensations for overtime, but it's just a commitment on your part to say we want to get things done, and one would like to appreciate you for that. Yeah, I think we've done what we were supposed to do. As I've indicated, then the department is going to come back to us on the 4th so that then we can continue to move on this aspect. And then as we do that, we know that as political parties, you should be doing all your consultations so that by the time when we meet, we exactly know what is it. Yeah, basically that's what one can say. And that the circumstances, safe to say, I want to thank you also for maintaining the decorum of the house. It's very nice when we treat each other with respect and give each other time to speak. I never experienced any form of disruptions That's very good. And I think this is the decorum of our meetings, because whenever we have issues, let's just continue to engage. Yes, and then I know it's late, this can be counterproductive, but then it's when duty calls. What must we do? We just respond to the nature of duty and do what is expected of us. Thank you so much, dear colleagues, and you must enjoy the rest of your evening, your caucuses tomorrow, and the weekend and the constituency days ahead till we meet next week. Good night.
Good night,
Thank you,
Chair.
Chair.
Good night,
Thank you, Chair.
Good night.
Good night, Chair.
And thank you, staff.